Good morning. Good morning. Thank you. We're going to be talking about artificial intelligence, but we need to reinforce our human connection. And so I always like to start with a good morning to everyone. It is a true honor and a privilege to be here in Seoul at the World Biot Summit. My name is Ricardo Baptista Leite. I am the CEO of Health AI, the global agency for responsible AI in health. And we are very grateful here at Health AI for the kind invitation we received from the government of Korea to be able to organize this session on the topic of responsible AI. And being one of the side events, to see a full room here is a great sign of the importance, but also the attention that this topic is attracting from around the world. I will be hosting and moderating this session today. And so I would like to express to all of our speakers, those that sent us videos, but also to those that are here in the room with us today, for their availability for joining us. I will be presenting them further down the run of the show. But I will be starting with a brief presentation about who we are and what we're doing in the field of responsible AI. And I want to let you to know a couple things just before we start. First of all, that some of our speakers may speak in Korean, but all of you have translation from Korean to English and English to Korean. Feel free to prepare your headsets for the rest of the session. And of course, you have the channels right here. And of course, we'd kindly ask you, since this is also streaming online, if you could please turn off your phones or at least put them on silent mode. That would be very much appreciated. And always feel free to reach out to us. I'm here, and also Health AI's Chief Regulatory Officer, Paul Campbell, who will be speaking, is also in the room. We're happy to meet with you today or tomorrow while we are here. So I'll be jumping directly to my presentation. And so I kindly ask the technical staff to put up my presentation. And I will be talking to you precisely about responsible AI in the field of health. And it's interesting that at Health AI, we conducted a survey when we were redesigning our strategy over a year ago, where we asked governments, patient organizations, university partners, and private sector partners what their thoughts were about the topic of artificial intelligence in health. And one of the most common words that came back to us in this survey was the word fear. People are concerned about the potential harm that artificial intelligence may have in their health, the negative impact it may have among citizens. But I think it's important to also enhance the potential opportunities that these technologies bring upon health systems, allowing us to rethink health systems, to be able to redesign how we are going to deliver health and care in the future. Today, most health systems are still too focused on reacting to disease. Artificial intelligence presents to us an opportunity to rethink the way we deliver health and care so that we can be more focused on quality of life, on well-being, on reducing the burden of disease, so that we can make sure that we free up resources to treat those that inevitably will get sick. And we already see how AI is being applied across the board. We see how from research and development to manufacturing and distribution, and we're at the World Bio Summit, this is a very key area for AI applications. But also when we talk about prevention, population health, the power of predictive analytics being able to have impact. We're already seeing that in different parts of the world. Post-care and monitoring, even in administrative management and other forms of management, hospital waiting lists, hospital bed predictive analytics, all of these things are happening. Many of these technologies are aimed at reducing costs. Other of these technologies are actually focusing on producing health outcomes, or a mix of both. One of the problems we are seeing, though, is that many technology companies, instead of using this opportunity to rethink how and imagine how we can use technologies to redesign health systems for the future, they're trying to retrofit the technologies into the current analog world of healthcare, the way it has been designed until now. So we need everyone, from healthcare workers, managers, private sector, academia, patient organizations, governments, to use this opportunity to think forward. How can we use these technologies to leap towards a future? And this is particularly important even in low and middle income countries, in low resource settings. So this slide shows you the distribution of startups across the world in the field of AI. And of course, the US has a very important presence. And we can see, of course, California. We know that here in Asia, and of course, South Korea, of course, appears with a very relevant dot in the map. Europe is more or less in the middle. But what we also see on this map is low and middle income countries, Latin America and sub-Saharan Africa and in parts of Asia, they are absent from this map. And so artificial intelligence, which actually can be the greatest equalizer of our time, may also be, if we are not careful in the way we design the ecosystem, may actually be the greatest divider of our time. It all depends on us, on how we design, develop, and deploy artificial intelligence into the world. If we do this correctly, we can actually accelerate the approximation between low and middle income countries and those that have most resources. But if not, what we already know as the digital divide may actually grow, leaving too many people behind. And so we need to get this right. We also see as a proxy, as a window into the future, how patents are showing the exponential growth of investment in this space. When we look at R&D, we see that exponential growth. This is from the last Global Patents Report. 61% of all patents registered are from China, 21% are from the United States, only 2% from the EU plus UK. Of course, if you do a quality-adjusted analysis to this, it'll be a bit different. But still, this is a pattern that everyone in the field has to be very knowledgeable about the reality we are facing today. But in reality also, I started talking about the potential applications of artificial intelligence, but I also said there's fear. And that fear, I would say, many times is driven by the hype of media. Sometimes it's not based on fact. But the truth is the fear is there. And there are risks that we cannot ignore. The problem is in most countries around the world, not every country, but in most countries around the world, there's still some level of Wild West environment where companies are coming in, they're selling their technology to hospitals, to clinics, and there's truly no really oversight or regulatory mechanism to make sure the technology is safe, effective, and quality assured. Moreover, in many countries, we still have zero to none post-market surveillance mechanisms to be able to detect if something goes wrong with the application of the technology with real-world evidence. And so it's important to address these challenges. Many countries around the world and regions are doing so, and they're applying, and we saw how in the US, the previous administration launched an executive order, the European Union launched the EU Act. There are many initiatives around the world trying to address these challenges. Even here in Korea, there's an AI Act being discussed in the National Assembly. And so this is leading to some level of fragmentation that is concerning, because one of our goals at Health AI, as the global agency, as a nonprofit, is to help the world use this technology and accelerate and scale the use of AI-driven technologies that can lead to better health outcomes. A fragmented world will lead to slowing down the pace of adoption of innovation. So there are 4 key challenges that I would highlight. That fragmentation issue, we need to have some level of global alignment, and that's what we were working on. But also the fact that AI is a fast-evolving technology. I'm a medical doctor, but I worked in politics for many years. I was a 4-term member of parliament from Portugal. And I can tell you that the political process is too slow to keep up to pace with the speed of AI and technology development. We need to give more power to regulators and make sure that the regulators have the capacity to keep up to pace with the technology, which means they have to have the resources to do so, so that we can accelerate that process. Data concerns, of course, are extremely important. The regulatory frameworks need to address data governance, data security, and data privacy. And once again, post-market surveillance. I stress on this point because I think it's one of the most relevant and important points when it comes to artificial intelligence in health. Being able to detect early on if there's something going wrong with the application of AI in a clinical setting is one of the most important tools we have to be able to build trust towards these technologies. I'll give you an example. As a medical doctor, when I prescribe an antibiotic to a patient with an infection, I'm not thinking very much about the safety because I know the safety was checked by the regulatory agency. What I'm concerned about is, am I prescribing an antibiotic that is the most effective to treat the infection of the patient I have in front of me? Today, when thinking about using an AI technology, healthcare professionals, doctors, nurses, pharmacists, managers, governments, before using the technology, they're second guessing. Is this safe? Can I trust what the computer is telling me? We need to get rid of those questions. And the only way to do that is by having a regulatory process that builds that trust so that we can use the technology and we know that in the background we have teams that are looking precisely at those components of safety, of quality, and effectiveness. And so we identified this challenge very clearly, that the lack of governance was increasing risks, of course, but it's also leading to lack of trust. And when people don't trust the technology, they don't adopt the technology. And we want to accelerate the adoption of technologies to accelerate its potential beneficial impact on health. So we need to address the global governance issue head on. And so that's where we came in as the Global Agency for Responsible AI in Health. At Health AI, we are a nonprofit based in Geneva, working with many partners and governments around the world. I acknowledge the presence of the government of Norway here, NORAD, one of our supporters. And we are very honored to be working with those governments and also with the World Health Organization, because this is a unique opportunity for us to truly come together. And how do we work? And I think this slide explains it better than anything I can tell you. We are a bridge in the middle. We're an implementing partner for governments. So on one side of that bridge, you have the normative standard-setting organizations. There are many organizations out there defining standards. In the field of health, you can think about WHO, international standards organizations. You can think about UNESCO, OECD. Everyone is either publishing guidelines or standards. We at Health AI do not do that. We do not publish standards or guidelines. On the other side of the bridge, you have the national and regional regulatory bodies. These are the bodies that have been mandated by governments to validate technologies. And we see their role in being able to validate AI solutions for health systems. And so we are in between. We do not validate solutions ourselves. What we do is, as an implementing partner, as a technical partner to governments, we help translate international guidelines and standards and adapt them to the local context, helping countries build up their regulatory capacity, co-creating their regulatory capacity to be able to validate AI solutions for their own health systems. So basically, our strategy is built up on 4 key pillars. One is to basically build up and co-create those regulatory mechanisms, so governments will be able to have a team within the regulatory ecosystem that is capable of validating technology based on the quality, based on the safety and effectiveness of that technology. Also putting in place health technology assessments so we can finally define a value to reimburse these technologies. And for private companies, creating a clear pathway to access to market, which today is not clear, making rules and regulations clear. As soon as we have, and we're going to be selecting 10 pioneer countries by mid next year, those countries, along with the others that follow, will be part of the global regulatory network that we will be managing. This global network of regulators will not only allow knowledge sharing, but it will allow us to also put in place a global early warning system. Once again, post-market surveillance is one of the most important elements to build trust. So if there's an AI tool that here in Seoul or in Rwanda or in Switzerland or in Brazil that shows any risk or has caused any harm, within this regulatory global early warning system, we will be able to raise a red flag in real time to all of the regulators, making sure that the private sector and the regulators can work together to solve the technological challenges before they become a problem at scale, so that citizens know that we are putting citizen safety first and that we are doing everything in our capacity to mitigate risk. And we will also be building a global public repository of AI solutions. So basically, as regulators approve the technologies for their own countries, they will be feeding into this single platform that everyone can visit. It's an open source platform where you'll be able to see what AI technologies are out there and which regulators have approved them around the world. This is useful for regulators to see which others have approved so they can accelerate their approval process. But it's also a global marketplace. So if you think about a technology that is approved in Korea, the first place, after being approved here, it'll be put on this global marketplace so everyone can see. And the same applies to a startup in a low and middle income country in Africa or Latin America. We'll be able to see innovation at a global level much faster and to see what innovations are out there and how transformative they can be. So we're helping to scale the impact of that technology. And of course, we will be able to provide advisory services to both public and private sector about how to make sure that you are applying the principles of responsible AI. But we can't do this alone. And that's why we've launched a community of practice. This Health AI community of practice is one that brings together governments and regulators, but also academia, civil society movements like patient organizations. It's also bringing together private sector companies and developers. Everyone who is involved directly or indirectly in the field of artificial intelligence and health is invited to join. You actually have a QR code. It's free of charge. And you can actually apply and be part of our community where we're going to foster conversations around the topic of artificial intelligence and health from a perspective of global governance and regulations. This is extremely important. And I invite you all to join as institutions because we have this vision and we will be working on this topic at a global level, but we need to make sure that our mission, which is to make sure that safe, quality, effective tools are being deployed and scaled as fast as possible to achieve the positive impacts in health, is actually happening on the ground. The only way to do that is having a feedback mechanism from those working on the ground. And we have to be humble in this new age of this intelligence revolution to be able to do this with all of you, with all of the institutions around the world that are interested and highly committed to the vision of the responsible use of AI to improve health of citizens, because we are absolutely certain that we can only do this together, and together we shall work for better health for all. Thank you very much. And now it's my pleasure being able to close this opening moment of our side event. I will be presenting now a video message from our esteemed colleague from UNESCO, Dr. Gabriel Ramos, who is Assistant Director General for Social and Human Sciences of UNESCO.
Dear ladies and gentlemen, thank you for this opportunity to speak at the third World Bio Summit on the challenges and opportunities for the global governance of AI for health. Healthcare is one of the areas that is really being transformed by artificial intelligence and magnifying the potential to deliver for good. AI is enhancing diagnostic, enabling real-time data, and holding great potential to tackle critical health issues. You remember during the COVID-19 pandemic, AI was really core to understanding the way the virus behaved, how we could advance the vaccine development, and it really revealed how data science and digital technology can improve health outcomes. We have some other examples. In Brazil, the government developed a platform that predicts dengue outbreaks, illustrating AI roles in managing public health crises. And in the realm of neurotechnology, the convergence with AI has revolutionized the way we understand the brain and opened the door to more powerful and precise applications. This is very promising, but AI developments don't come without ethical concerns and risks, especially for vulnerable populations. We know that AI poses challenges around data privacy, health equity, misinformation, and fundamental rights. Global governance have not yet adapted to address this risk comprehensively, particularly in the Global South, which often lacks the necessary regulatory frameworks for safe and equitable AI use. And the disparity in AI health capabilities between the Global North and South continues to widen. While advanced AI diagnostic tools aid early disease detection in many countries in the North, regions and members in the Global South struggle to deploy even basic AI technologies due to limited resources. This is a great challenge, not having access and only benefiting the few. AI initiatives for tuberculosis detection in sub-Saharan Africa face hurdles, for example, including limited internet connectivity and high equipment cost, unlike the rapid AI and neurotechnology advancements in the US and Europe. The technological advancements in health sector also raise serious concerns about privacy, autonomy, and equality that really need to be well framed, and it was included in our UNESCO 2021 recommendation on the ethics of artificial intelligence. We are addressing these concerns also in our current work to implement the recommendation and in the development of a normative work on the ethics of neurotechnology. And aligned with the conference theme, which is the Triad Future Investments for a Healthy and Secure Decade, I suggest that we could have a path forward that centers participatory engagement and diverse stakeholders in AI health governance. Engaging a variety of voices, including patients, healthcare professionals, marginalized communities, in policy discussions will foster more inclusive AI outcomes. Training healthcare professionals with ethical AI, data privacy, and patient rights will empower responsible AI adoption in healthcare and would make it more fine-tuned to really address what patients want to be used AI for. And finally, addressing the global data imbalances is crucial. Data is fundamental for AI development, yet many regions lack accessible, representative, high-quality datasets, even in the context of open source. Making data more equitable will support a truly global research ecosystem. At UNESCO, we are advancing this commitment through the implementation of the recommendation on the ethics of artificial intelligence, which is the only global standard in this field covering 194 countries. To support all of our member states, we have a network of AI experts without borders that provides real-time policy support, exemplifying our dedication to inclusive and ethical AI governance. Advancing these frameworks demand also fulfilling very core requirements and commitments to fairness, to equity, to justice, and to be even aware that these issues are important to bring to the fore and not only the technological conversation. Through a collective dialogue, we can develop governance that upholds human rights and health equity, ensuring that the AI serves our shared commitment to humanity.
Thank you. We have an online audience, and your applause has reached Paris for sure, where Gabriela Ramos is based at UNESCO. And I think she brought in very important topics. So that, as you all know, the session is called Challenges and Opportunities for the Global Governance of AI for Health. And the work that UNESCO is doing is particularly relevant, as she mentioned, in the fields of policy, data governance, and basically on the ethical AI governance. And so this is something that we're very grateful to Dr. Gabriela Ramos. We're now going to move towards our in-person presentations. And following that, just for all of you to know, we'll have a panel discussion, and there will be an opportunity for questions from the audience. So you can start thinking about those questions. And we're going to start with the topic. And so, as I said, we're talking about challenges and opportunities for the governance of AI and health. Now we're going to focus a bit more on the opportunities side. And so we're going to hear from, and being in Korea, we had to have the Naver Corporation present, of course. So Dr. Henju Yu, who is Director of Digital Healthcare Lab at Naver Cloud, a subsidiary of the Naver Corporation from Korea. Thank you so much for joining us. I told you it was going to be impressive. Thank you so much. And what we heard here is truly a major leader coming from the Republic of Korea, which shared with us that actually it's the third country in the world with a foundational model. And seeing how your work around virtual chatbots, your work around patient-centric approaches, your work around addressing key issues that are so difficult today, interoperability, healthcare worker shortages, and so forth. I think even with the MedMax project, I think these are very important examples, but also as a major corporation, the concern around risks and security threats and addressing that from a responsible AI perspective. And so I think it was a very good framing of our conversation, and thank you very much for that. We're going to continue now with our next presentation from Professor John Lim, who is Executive Director at Duke National University of Singapore, their Center of Regulatory Excellence, CORE, being Singapore one of Health AI's partnering countries. And we are very, very grateful, Professor, that you have come all the way to join us here. We look forward to your presentation on the topic of participatory engagement of diverse stakeholders in development and establishment of effective governance for AI systems in health.
Thank you very much, Ricardo, for this invitation. It's a great honor to join you at this side event of the World Bio 2024. And thank you very much also to the Government of Korea and the Ministry of Health and Welfare and WHO. I've been asked to speak about participatory engagement. Just to give some background on myself, I was formerly the Chief Executive Officer of Singapore's Health Sciences Authority, but for the last 10 years, I've been running the Center of Regulatory Excellence at the Duke National University of Singapore Medical School, and I continue to be a senior advisor in the Ministry of Health. The center was set up in 2014 to really look at the issues related to health products regulation across the region, and we're supported by the Ministry of Health, the Health Sciences Authority, and the Economic Development Board. And we're looking beyond just capacity building, but also to promote policy innovation, of which AI currently is a key area. And we're looking at establishing regulatory networks. So we look forward to working with Health AI as we move forward. The scope of the center is to build up this network collaborating platform, and we're building up to the two bars on the top of the screen, which are to strengthen regulatory systems where we started, which was a focus on health products, but now we're also looking at health services and health systems, as I will explain in a few moments. We have an education component, a think tank component, and also an advisory area as well. What we have been looking at, especially as we have gone into our 10th anniversary this year, is that we notice that there is a convergence as we look at health regulation. So while we ourselves, as a center, began focusing on health products regulation, which is also where I came from in the HSA in Singapore, we see this convergence with health services regulation. Of course, there's also health professionals regulation. And what is interesting in Singapore is that where previously the Health Sciences Authority looked mainly at health products, which is where medical devices and AI-related products sit, the Ministry of Health was focusing on health services regulation, and that's also important when we think of the application of AI. And they are going to come together in the coming year, in 2025, so that products and services regulation will be increasingly converged. As we looked at our 10th anniversary year, the areas that you see on the left of the screen, or was it the right of the screen? The right of the screen are the key areas that we thought are important to look at. And obviously, AI and digital health is a key issue for us to focus on. So when we look at governance in AI health systems, there are many issues to think about. In terms of AI in health, there is a lot of potential. We can look at improved outcomes, personalized medicine, enhanced patient care. But as has been mentioned several times already this morning, the importance of governance is there. We need frameworks to establish and ensure accountability, responsibility, and ethical decision-making. We need to address concerns over safety and efficacy in AI applications. And so this whole aspect of ethical considerations, and the previous speaker highlighted this as well in terms of his company, we do need to ensure fairness, transparency, and non-maleficence. This must underpin AI development and especially the use of AI in health systems to address potential biases. And of course, we need to ensure that technologies uphold the dignity of patients. So what my center did earlier this year in April and August was to work with the Singapore Ministry of Health to hold 2 roundtables. The specific question was to ask, within the Singapore context, does healthcare AI require a distinct AI governance framework? So as you can see on the upper right-hand side, the objectives of the 2 roundtables were to look, of course, at the scope of healthcare AI, but what are the key challenges in deployment and development, and then how, as we bring the stakeholders together, which is what this talk is about, how do we then develop potential regulatory approaches to enhance AI governance and stakeholder accountability. So we brought experts, not just from Singapore, but there were international experts as well in the 2 roundtables. And I will share towards the end of this presentation what the conclusions were. So when we think of participatory engagement, when we think of AI in healthcare governance, obviously, if we're talking of participatory engagement, we must have very inclusive and collaborative processes that bring together diverse stakeholders so that, in a sense, all the key people who are engaged in this can contribute to decision-making. And this will ensure that governance strategies are representative and, of course, importantly, grounded in shared values. We're doing this at a national level, but as has already been indicated this morning, we need to look at this regionally and globally. The significance of engagement is to then ensure that the voices of all the relevant parties are heard and considered. And this is really vital for creating AI systems that are equitable and responsive to community needs and ethical standards. And there are many benefits also to engaging diverse stakeholders because we then bring in varied viewpoints and experiences. This also ensures more innovative solutions. We come out of siloed thinking. And it helps to reduce the risk of biases and blind spots in AI governance, which can be rather significant if we only look at it from a particular stakeholder's perspective. If you look on the left side, when we assembled the roundtable participants, we were looking at primary and secondary stakeholder categories. So there are those in the orange boxes who are directly impacting or impacted by healthcare operations, policies, and outcomes. Obviously, patients and families must figure significantly, but there are healthcare providers, healthcare organizations, also payers and insurers have to come into the picture, regulatory bodies for sure, and obviously the developers in terms of pharmaceutical, medical device companies, and other, I would say, industry partners as well. The secondary categories are those who are supportive of or facilitate, but they may not be directly responsible for healthcare delivery. It does not mean they're any less important in stakeholder discussions. And these would include academic research organizations, technology IT companies, but also remember professional associations and unions. The policymakers and legislators are very critical. Also remember NGOs, non-governmental organizations and advocacy groups, the suppliers and support services, and importantly, media and communication stakeholders. So when we held our roundtable, we tried to bring in as many of these as you can see on the right-hand side. We may not have included everyone that I listed on the left, but there was a fair representation across the stakeholders in those 2 roundtables. And so I think that's a useful sort of approach to take in any stakeholder engagement as we look at strengthening AI governance guidelines and frameworks. Now, what drives diverse stakeholder perspectives? We need to remember these 4 things as well as we engage stakeholders. There are different motivations of the stakeholders. There is a need to promote inclusivity and inclusion. Transparency is extremely important. And again, as has been mentioned several times today, trust is so important because if the trust is not there, it's not just the patients who use AI in healthcare, but amongst the stakeholders themselves. If there's no trust amongst the community, then it's also difficult to really get significant stakeholder engagement. So when we think of motivations, we need to understand diverse motivations, ethical, economic, social. These would drive the stakeholders to participate and also ensure that the frameworks align with the various interests and needs. When we think of promoting inclusion, we need to ensure active inclusion. It has to be a very proactive, intentional process, especially of underrepresented populations. And the governance frameworks then need to address equity and access to ensure that systems are just and they benefit all. For transparency, this is also important because transparency in decision-making processes will help to demystify AI technologies. I'm afraid it's not possible to totally demystify because of black box concerns and the way algorithms work. But as we bring the stakeholders together, transparency, to whatever degree is possible, will help to lower fears and to raise confidence among stakeholders about the use of AI in healthcare. And of course, building trust is essential for encouraging stakeholder participation and ensuring that there are accountability structures, because this helps to provide assurance that all voices are respected and considered in the governance process. There are various frameworks to encourage effective participation. So the earlier stakeholders are involved, the better. Feedback loops need to be set in place. There need to be collaborative dialogues. There has to be a co-creative element so that design and approaches, there's co-designing and co-creation of approaches, and there has to be public deliberation. And then, of course, from a more academic perspective, case studies are also very helpful. So in terms of the 2 roundtables that we held, we used mainly collaborative dialogues and we analyzed case studies. And when we brought the participants into the room, it was not a lot of presentations. We actually broke them up into work groups. So some of the participants, and they were very senior experts, said it was like a boot camp. But they were not complaining. They said it was a very good thing to come together and work through the issues and look at case studies. When we think of the more specific issues related to tools and methods for engagement, these are some of them. The collaborative tools in digital platforms, surveys for feedback, community meetings, workshops, and focus groups. And so the center itself, not just specifically what we did this year, but we have always been promoting the use of workshops and focus groups because these bring the stakeholders together to facilitate in-depth discussions. Roundtables are very important to create trust and enable open dialogues and provide this direct channel for voicing concerns and opinions. And of course, even if we cannot come together physically in the room, like even this event today, technology-enhanced platforms, virtual live streaming platforms are very important to allow meetings and experts to talk, to connect, to share perspectives, and to participate in real-time discussions. What are some of the key challenges to engaging stakeholders as we want to engage them in looking at the governance of AI in healthcare? I've mentioned trust issues, but there are also resource allocation issues because there's never enough time, there's never enough funding, never enough personnel. And there are obviously barriers to engagement because of socioeconomic disparities within and across regions, but there are language barriers. It's also been mentioned there are cultural barriers, and there's also lack of awareness. So some potential solutions, they look simplistic, but to do them can involve quite a significant amount of effort and intentionality. There should be constructive engagement to build up trust, to demonstrate commitment, and respect is also very important. There needs to be an assessment if resources are not enough, then how can they be strategically allocated? And obviously, when we're thinking of barriers, they must be identified first and itemized so that then suitable strategies can be found to address them. It is also important, having gathered all this information from the stakeholders, to properly evaluate them and to assess them. So there are obvious methods which I think everyone in the room would be familiar with: quantitative, qualitative analyses to ensure that there are robust feedback mechanisms. And some of the metrics of success are indicated here. What is the degree of satisfaction at the end of the day in terms of the engagement and the outcomes and outputs? How diverse have the participants really been in terms of the engagements? And what has been the quality of the feedback? So this is important. So as I come to the end of my presentation, as we went through those two roundtables earlier this year to look at healthcare AI governance, firstly, that diagram that you see in the yellow box, these are regulatory tools that regulators can use. Not everything is just regulations and legislation on the extreme right-hand side, but even areas like stakeholder education, industry self-regulation, guidelines and standards, regulatory sandboxes, and accreditation all form part of the regulatory toolkit of regulators. So the two roundtables concluded that in Singapore, at least, we did not at this point require new legislation, and the current regulatory tools are good, but they need to be reinforced and enhanced with additional guidelines, and their scope needs to be tested. So for stakeholder education, beyond what currently exists, the recommendation was that there should be more consumer education, specifically for lay persons and even for healthcare professionals. And it was interesting that in some of the discussions, not in this particular roundtable, but in another session that we had on AI earlier in the year, it was identified, we always think that younger healthcare professionals might be more open to AI, but in fact, a study in Singapore has shown that it is in fact the older, more experienced doctors, nurses, who are more sort of open to using AI because they can fall back on their experience, whereas it is the younger healthcare professionals who sometimes are more hesitant to use AI because they don't have that degree of experience. So that was a very interesting understanding. For guidelines and standards, we already have existing guidelines for AI in healthcare. Now, in Singapore, there are a lot of multi-ministry engagements, but in a specific term, while most of the medical devices in Singapore are managed by the Health Sciences Authority, the Ministry of Health has a set of guidelines called the AI in Healthcare Guidelines, and the short form AGILE, it's pronounced, actually indicates that regulation needs to be agile and the guidelines need to be agile. So the conclusion from the roundtables was the guidelines are still good, but they need to be enhanced. But we do need to look at areas like data labeling and accountability, trustworthiness of algorithms, contextual risk, and also how to strengthen the professional guidelines and advisories for professionals. There needs to be more use of regulatory sandboxes to test the scope of existing regulations for emerging healthcare AI needs, specifically the usage of real-world data and also multiple data platforms and the use of generative AI. But for the health products approach, it was felt the existing regulations by the Health Sciences Authority are sufficient at the moment. So from this, it gives us a sense how we go forward in terms of taking the stakeholders within the Singapore healthcare ecosystem and bringing them together as we continue to look at strengthening healthcare AI governance. Finally, as we think to the future, we still need to have, in fact, a very agile approach. So innovative governance approaches are important. We need to have decentralized governance systems. We need to have flexible governance models. And of course, Google DeepMind is a very interesting approach. When this article was published in the Straits Times in Singapore, what struck me was that the sensing of the need to look at regulation was rather limited there. But it is important nonetheless, as we go into areas like this, to strengthen the stakeholder collaboration, to have early engagement, sustained collaboration, so that the innovators work with the policymakers, and this is vital for ensuring agile, robust, and fit-for-purpose health AI governance frameworks. I would like to thank my colleague, Professor Kavita Paleniappan, who helped me prepare this presentation, and to thank all of you for your attention this morning. Thank you very much.
Well, thank you so much, Professor Lim, and I think that it's easy to understand why Singapore is also among the forefront of countries dealing with the regulations of AI in health. Your methodologies that you approached in terms of participatory engagement with different stakeholders, I believe, is actually a very good example for other countries and regions to look at, and how you address the need for engagement not only within the country level, but also at the regional and global level, I believe is part of the reason why this collaboration between Health AI and Singapore is presented as so relevant. And I think you also presented, this is a very new field for many, and how even some of the most advanced countries like Singapore have such a humble approach, I would say, acknowledging, despite having such robust regulatory frameworks already in place, always the need to improve, to enhance, and to continue to move forward, and also the issue of sandboxing of technology, which is actually one of the topics that at Health AI we are including within our technical assistance and support to governments, because we also too acknowledge this as a very much needed approach from a technical perspective, not only regulatory sandboxes, but also innovation sandboxes to foster the responsible use of technologies and AI in health. So moving on, we're now, this is next presentation is someone from Health AI, but I'm very happy to be able to present Dr. Paul Campbell, because it's his first week on the job. And so we're very happy that he was able, on his first week at Health AI, to join us here in South Korea. Dr. Paul Campbell was, until very recently, the head of software and artificial intelligence at the United Kingdom MHRA, the United Kingdom regulator, with 20+ years of experience within the Scottish NHS, a physician himself, but highly specialized in the field of AI and software as a medical device. And now, Dr. Paul Campbell is Health AI's Chief Regulatory Officer. And today he will be speaking to you about existing regulatory frameworks to oversee AI systems in health and foreseen gaps. Paul, we're very happy to have you here. The stage is yours. Thank you.
Good morning. Thank you very much for the opportunity to be here for myself and for Health AI. I'm delighted to talk to you today about existing regulatory frameworks for AI systems. As Ricardo said, this is my first week with Health AI. So this is more a reflection from probably my experiences working in the healthcare system and as a regulator. So I'm going to start off by explaining that I'm not going to explain something that's super complex. The reality is the regulatory mechanisms of the world are a highly complex system. You know, they're beyond complicated. In 15 minutes, I couldn't tell you what all the regulatory frameworks are. So that aspect's a bit pointless. So that means there's no point in me speaking to you. No, of course not. I'm going to tell you try and break this down to some basic things that I think just are good start points to help understand the regulatory frameworks that are important for AI in healthcare. So one thing, there are 2 million different types of medical devices in the world, roughly speaking. No one even knows the exact number. There are 7,000 different categories. Some people say there are 10,000. No one knows the exact number. Trying to regulate something that complicated, you'll understand. And to be honest, that's all before AI. So these numbers don't include the explosion of AI and AI agents that we now see. So these are very out-of-date figures already, and I produced the slide last week. So next one, yep. So in terms of what are the regulatory landscapes, what are the regulatory frameworks that exist, these are, some of a number of different documents. The first one on the left there, the Global Atlas of Medical Devices, is the WHO document. It gives you a list of all of the different types of regulatory agencies and mechanisms that exist around the world. It doesn't necessarily explain what's there for AI or for software. And there's some others. There's some papers, that one there, about the developing landscape and sort of for medical devices in Africa, indicating how it's not really sufficient. And then we ourselves within Health AI have recently put our first iteration of the sort of mapping of the governance in Health AI, mapping of the governance and health of AI medical devices. So we too have joined this journey. So there's loads of things out there if you want to try and see. I can't tell you all in 15 minutes. It's too complicated. What I am going to try and do is try and make it a bit simple, try and give some principles, and I hope this is okay for everyone to try and help you understand the regulatory position, the mindset, how regulators regulate medical devices in general, because that's relevant for AI. So just going with basic principles. The first thing to really make clear and obvious, to my knowledge, I think all medical device regulators in the world that have any regulation in place more or less regulate AI under the term of software. So again, to my knowledge, and I haven't scoured every single one, every definition is uses this word software, and nowhere does it specifically say sort of AI within the definitions, within the legislation itself. There are lots of guidance documents, but within the legislation, it's all based on this concept of what's the definition. And that's the WHO definition. It holds very true to many of the definitions used in regulations all over. So it's a device, a thing, software that has a medical purpose. So that's the first most important principle to sort of think through. I went in for time. And again, this definition I know is very closely aligned to the definition in the UK legislation, which is effectively about 20 or 30 years old now. So these definitions are what's in the world's legislation, and they were all written before AI. And as Ricardo, I think, mentioned, and I too obviously work for UK regulators, part of the UK government mechanisms or the civil service, changing legislation takes a long time. So that's legislation, that's where we are right now, it's with software. So I'm going to talk about what's the approach for AI. Bear in mind, from a legislative point of view, that's just software. And again, these are just general principles of approach. In general, all medical device regulators approach all medical devices, and that's everything, the hardware devices, the software, the AI, with these sort of three principles. Firstly, does it even qualify? If it's not a medical device, then the regulators almost sort of stop at that point, and they have no legislative need or ability to engage beyond that. There's a very key important point. I think this is quite important. I think from colleague Dr. Yu spoke about sort of the population health aspects of it as well. Medical device qualification is for devices that are for individual patients. So generally speaking in the legislation, if you're using AI at a population level to understand population healthcare and you're not directing it to an individual's care directly then it generally doesn't qualify as a medical device. So the medical device regulations become irrelevant to you at that point. So I would argue that AI is just the same as SAMD is software as a medical device. So AI is the same as software here. The next thing that all regulators do is they then, if you qualify, so you are now a medical device, we will then start to talk about it with you or work through it. Generally, everyone then looks at a risk-based approach, and they want to try and classify the risk. All the different countries have different names, ABC, 1, 2A, 2B, but in general, in the main, all regulators classify in either a 1 to 3 risk category or a 1 to 4 risk category. Generally speaking, class 1, or the lowest level of risk. In many countries, these are what we call sort of self-certified or self-registered. So these are products that may well be registered as medical devices, but that's only done more or less by the manufacturers of the device themselves. They're registered, but no one's really looked at the evidence of them. So in general, I'm making very broad statements, but that roughly applies. And as it goes up beyond that, levels 2 and 3, or 2, 3, and 4, then usually at that level there's much more scrutiny applied because these devices carry more risk. And again, I would say that whether that's software or AI, that's the same for AI. And then one of the next things that they routinely do for any device you have is clinical evidence. It's a really simple question. As Ricardo mentioned, I'm a clinician, or I was a clinician myself for many years. As any other doctors, clinicians in the room, or even just any other person would understand, the simple question, does it work? Really simply, does it work? Can you prove to me that it works? And we add on to that in health, can you prove to me that it's safe? So generally everyone else has some mechanism of doing that, and it's usually driven around clinical trials, clinical investigation, and that's a sort of caveat that stays with us. And our colleague, Professor Lim, I think, mentioned the importance of that sort of evidence as well. The approach taken in clinical evidence is not the binary, is this a medical device or is it not? It's not the binary, is this perfectly safe or is it not perfectly safe? Because that's not reality. It's a benefit-risk analysis that always goes on. What's the current system? What's the current level of healthcare? Does this product improve the benefits over the risks? And then the last bit there, PMS, post-market surveillance, that's a mandatory feature in general for all medical devices around the world. So that's Paul's sort of And again, AI or software is the same. So that's Paul's one-slide summary of the global picture of medical device regulations. Hopefully that helps a little. Regulations are always backed up in this sort of hierarchical order: regulations, and then standards, and then after that, guidance. And I know I've just come from the UK MHRA. They have a legislative programme going on there at the moment, and the phrase used, it's legislatively light and more relying on guidance, because there's a need for that agility to improve the guidance. Even standards in the middle, standards take a long time to do as well. And we're awash with all sorts of standards. That's just some that I found from various agencies there. So that's your general approach if you want to be involved with AI medical devices, is to know the regulations, to do those according to standards, and then look at the general guidance. And that's evolving rapidly around the world. And in general, the more you go to the left, the slower that becomes, and the more you go to the right is where we probably all are as a global community on this. So that's all of software. But what are so far I've made the case that AI is just software. It's just handled by the regulations of software. But I think we know that there are some differences with AI technologies as opposed to standard software. So I've put them in these 3 buckets: bias, transparency, and adaptivity. Different people use different names for them, but bias is probably one of the commonest ones. The human nature of it, the fairness of it. But from more of a technical standpoint, bias is really important because it will impact on the performance. There's some good evidence of studies where there was a chronic kidney disease monitoring AI system. It was really, really good in the population. You move it to another hospital, different population, different ethical group, and the performance just drops off. So from a safety and performance point of view, that's really important. But as I said, it also worsens the health inequities. I've listed there one project that we worked on, again, when I was with MHRA, so I'm a transition point here, was standing together data diversity. It's got like a really, really good collaborative program of work, but again, coming out with recommendations of what you have to do with your data when you're developing your products. Transparency, now that's also transparency, explainability, interpretability. These are all different terms. But I think one thing that's really important from a more technical basis is, can you explain the decision? If your AI product tells you to give the patient the medication, and then the patient asks the doctor, why are you giving me this? I don't think the answer can be, I'm not sure, the computer said that I should. Like that doesn't work, that doesn't engender trust. So, and as Professor Lim pointed out, it's transparency as far as we can. We can't always get to the bottom of the transparency of AI models, and that's maybe not necessary, but we have to understand enough to be able to explain it. So transparency and explainability, otherwise you lose trust. Adaptivity, unlike standard software, there's a big problem about performance drift, performance and concept drift that can occur when you use AI technologies. So the nature of the changing response to the algorithm, how the system around about it changes, and these are complex system changes that go on. That's one of the other reasons that post-market surveillance, whilst it's mandatory for all devices anyway, it becomes even more critical for AI. And there's a move in the world where people are struggling to generate the sort of pre-market evidence for AI, to maybe bolster that by having good post-market surveillance. And maybe that's even akin to what is known as real-world evidence. Can you get something on the market and run it under strict observation to generate that real-world evidence? So that's, I believe, whether there's sort of technical AI differences. Beyond the technical AI differences, there are more sort of ethical AI challenges. I call these things. I've got accountability. It's really difficult. It's okay potentially to have a human in the loop and have an AI-guided clinical decision support, and then the clinician or the doctor or the nurse puts their head to work with the AI and says, I think this should be the course of action. That's okay, but what if we have a fully autonomous system and it makes a mistake, it gives you the wrong judgment as a patient? We haven't really sorted out the accountability or the liability for that. I'm going to just rush through a few of these for time, folks. Privacy, intellectual property, where do people get their data? These are huge challenges. There have been many breaches. None of that engenders trust. At a societal level, we have a real issue that, done poorly, we will worsen inequity of healthcare. John also mentioned that we should have maybe coordinated on slides a bit before, John, the knowledge and the skills. There's a real awareness and there's a real skills gap across all players, from patients, from citizens to purchasers, to developers, to regulators as well, even at times in certain aspects. And there's an economic cost in all of us investing, lots of time, money and effort in some of the wrong things at the wrong time. We can end up with the wrong solution to a specific problem. That's particularly important to us here at Health AI. If we're looking at low and middle income countries, they may have very different sort of health requirements compared to where I live in the UK, for example. So that's the ethical one. What and how are we regulating this? This comes a bit to John's slide, who we'll hopefully see in a moment. So we do regulate medical devices. At times, we're now in the territory of thinking, this thing is not a medical device. It has a health purpose, but it's not a medical device. It doesn't qualify. And then how are we regulating things from that sort of societal and ethical, from the societal and ethical aspects for the whole of the population? We generally do regulation. You hear this language, I hear this language a lot, and if you hear it, hopefully this will explain it to you. People talk of horizontal and vertical legislation. So in the world of medical devices, we have the vertical of medical device regulations. Everyone follows that strong vertical. There are other verticals that exist for commercial products, for finance products, for privacy aspects. Each one of these verticals already has existing legislation in place. And the world AI sort of disrupts that fairly significantly and is leading to people to contemplate putting in what we regard as horizontal legislation. It's interesting that you'll have heard of, Ricardo mentioned the executive order in the US or the EU AI Act. That's a sort of horizontal legislation. Some people are doing that. Some people are not doing that. They're doing, I think, what John mentioned, which is say the current legislation sort of works. We maybe just need to tweak the guidance. So there's some really, valid conversations going on in the world right now about whether we need to increase more legislation at a horizontal level or just stick with the verticals and do enhanced guidance. So I'm not giving you an answer to that. That's where the regulatory discussion is right now. And it's a complex world. Anytime you put in the horizontal legislation, there's a real live discussion in the EU right now about the implications of the EU AI Act for the medical device regulations. How do they work together? It's a really important thing. It takes a long time to work it out. So it requires strong collaborative approaches. Many parties have to be involved in this, as again, John's list of stakeholders. So collectively, whilst there's legislation and regulation, I'm here to talk to you about regulation. I think there is an important trend towards, yes, we must have that regulation. Yes, we have to improve that regulation, be that through guidance. But yes, we also have to start thinking about responsible approaches. We have to. There's a wide picture of trying to align globally on this. This is very much a global game. The sort of the standards and the guidance. That it doesn't ultimately help us all if everyone develops something completely different. So we have to align that. Skills and capacity, and of course the early warning system. That's akin to the sort of post-market surveillance world. The ability to let people see the successes of products that we use, and then. At Health AI, we're also, as Ricardo mentioned, developing this knowledge portal, the community of practice, which is very much in that space of the building skills and capacity. So that's a sort of link back to what we're doing at Health AI, but hopefully was a useful explanation of Paul's view of the complete global picture of regulations of medical devices. Thank you.
Well, thank you so much, Paul, for that presentation and overview. I think it sets the scene very well for the panel discussion we're going to have. As I said, there's going to be room during the panel discussion now where we're going to have questions from the audience. So if you have questions that you're burning to come out, your moment is coming. But I just want to say that out of all of our presenters, sadly, Christian Wickert had an unfortunate episode where his airplane actually had engine problems while they were flying over the Pacific, and they had to fly back to the US when he was coming to Korea. But he was kind enough, as soon as he landed, to record a video to send to us so we could get his participation. So Chris is the head of global digital policy at Merck, the German pharmaceutical, and we're going to share his message now.
Hello everyone, I wish I was there with you. I wanted to start by thanking Dr. Ricardo, all the Health AI team, all the other panelists and authorities present at the event. Let me start just by sharing some of the initiatives that we have around responsible AI. It all started many years ago with the digital ethics team, something that we've built based on everything we've learned on bioethics. And this digital ethics team facilitated many discussions to create our code of digital ethics. And this process is even published in a peer-reviewed paper. It has 5 core principles, and they really guide everything that we do. So if anybody in the company has an idea, a digital idea or AI idea that they want to pursue, it will come to the digital ethics team, and the digital ethics team will present them to our digital ethics advisory panel. We created this panel with experts from the industry, from academia, globally, with some civil society representatives. And this digital ethics advisory panel will discuss all those solutions and really give an external point of view and a recommendation on what we are doing. So it's really ethics by design. Another good example is the PARA assessment, the Principal at Risk assessment. So if someone brings a project to that digital ethics team, they will assess for each principle and see if there's anything at risk. And that will be brought to the digital ethics advisory panel that will really discuss and see if the project should continue, if it should stop, or if there are specific risk measures that should be taken to mitigate some of those risks before continuing. Another example is for the data analytics and intelligence team. They have a digital tool where they answer a few questions, and that will give them a green light or a yellow-red light to pursue that analysis or stop and say, hey, you should discuss this with the digital ethics team before doing that analysis. So it's a control point even before running an analysis on data that you have. And we believe that this kind of ethical process is really what guarantees that the outcome will be aligned with what we really want. We also created many other AI solutions. So we created a venture, a 50-50 joint venture between us and Palantir called Syntropy, really to make science faster, to create a platform, an ecosystem where all the stakeholders can bring their data. They have full control of their data during the whole time, and have the most secure platform to guarantee that they know who's assessing that data with what kind of opacity they want in that data, to really break the silos and guarantee that data is being shared in a responsible and absolutely secure way to deliver the outcomes that we want, the new treatments, the new drugs, the new efficiencies that we are all searching. And we can only do that with this trustful collaboration. And this platform and Syntropy was built exactly to facilitate that. But we also have some internal products developed, for example, in the bioprocessing part of it. So we have Cynthia and Edison. Those are solutions that we developed that other pharmaceutical companies can use, other researchers can use. And when you think about that, it's really our health market is so big. There are so many elements in this value chain, so many different applications for AI, from right at the beginning when you're trying to find a new molecule during the trials process, after the market, for the healthcare systems, for the patients, the physicians. There are so many elements. It's so difficult to regulate all of that. And it's difficult also for governments and for others to see what kind of trusted solutions are out there. That we really believe in transparency. We really believe in having this ethics by design, so that you guarantee the outcomes based on a process that, you know, during the whole process you're being ethical. And that's also why we believe that health AI is so important in terms of gaining speed for all the stakeholders. How can I learn if some solution is ethical, is responsible, and I can trust? If there are institutions that facilitate that, that really allows government to quickly come and see, oh, these tools are responsible, these tools we can use. It will generate a lot of efficiency globally for the whole system, so that you don't have each and every one doing the same analysis and the same assessments and kind of getting lost among all this plethora of solutions available right there. And lastly, we also believe that governments play a crucial role in preparing the foundations for all these innovations to really flourish and gain scale. We have been discussing with governments around the globe on the importance of pilots, of initiatives that will use some broadly available tools, but apply industry-specific models, apply initiatives to develop talent and expertise that will work in all that. So I really hope that this panel helps to bridge some of those gaps, to bring everybody together, to keep discussing what are the main issues and how we can deliver those solutions to more companies, more researchers, more governments, and really deliver the outcomes we are all searching for. So again, thank you so much.
So thank you so much, Chris Whitaker. Rickert, we're very grateful for him being able to record this video after such difficult circumstances with his travels. And he brought, I think, very important topics also to the discussion that we've been briefly touching upon in the previous conversations around the issue of data, of efficiency, about the idea of coming as a pharmaceutical company, the usage of AI for the discovery of new molecules. These are all incredibly new areas that demonstrate the need to build basic regulatory capacity that in many countries and regions around the world is either non-existent or needing for enhancement and improvement to be able to respond to some of the issues that Chris mentioned around how do we address and ensure that technology and AI is used responsibly, and how do we actually scale technologies. And so we're now going to be able to move towards our session. All of our speakers will be joining me on stage. Once again, thank you to all of you for your speeches, but we have one more addition who I'm very grateful to welcome, Dr. Dongmin Kim, who is CEO of JLK Inc. For those of you outside of Korea, in Korea everybody knows you, outside of Korea, just to make sure that JLK Inc. is Korea's #1 listed company in the medical AI industry, specialized in AI-driven medical imaging and diagnostic solutions. Also a very important angle to be discussed in this context. We need to bring together the public sector, the private sector, civil society for this conversation. I invite all of our speakers back on stage. And an applause for our speakers, please. Okay, so we've made it here. Now we're going to continue the conversation. I'm going to start with the first question. Let's call it a generic question for all of you. I'm going to kindly ask you to keep your answers as short as possible so we can then find time to open up for the audience. And I'm going to go back to what Dr. Paul Campbell mentioned, because I think he distilled a very complex issue into a couple very basic but critical questions. You know, he was talking about benefit risk analysis, there's an idea that we sometimes hear in the media that we want an utopian approach to AI, where we want it to be perfect before we use it. That is not possible. In medical school, the first thing we learn is first do no harm, which does not mean only do something if you know it will not cause harm. What first do no harm means is mitigate risk. We've done that with the pharmaceutical products industry and also with medical devices, where we know there are risks, but the benefits clearly outweigh the risks when they are approved into the market. So this benefit-risk analysis is critical. But then Paul said, ultimately, for those working in the field, the two questions that people ask are, does this work? And is it safe? And these are two critical questions that we need the ecosystem to be able to answer. And so my general question to all of you, and maybe we can start from this side until that, and once again, we might be speaking English or Korean, so always have your translating set with you. So what are the facilitators and barriers that you see when it comes to promoting responsible AI innovations in health?
In my case, the passion of medical staff is most number one factor of facilitation of adaptation of innovative AI in healthcare, because in Korea, the medical situation is tough, but many medical staff are very motivated to study and adapting advanced AI system in their system, alongside with some risks. But they have high confidence that we can make it effective one in someday. And most barrier is, I think, two factors. Number one is data silo. I think that is common in worldwide issue. We have many organizations, and many organizations have concern about privacy and security, and also they have some kind of culture to preserve their data in their local systems. And number two is the concern about the risk of harmful AI in this field. So, as you said, performance and accuracy is not that clear in, especially in large language model and foundation models. So many people are concerning about that, and even the regulation organizations have a difficult time to make concrete regulation on it. Thank you.
Thank you very much. You've highlighted two key challenges, the regulatory environment, but also the data silos. And we've heard that, you know, if AI was a rocket, data would be its fuel. And so it only moves with good quality data, and that's a challenge that needs to be overcome. And data governance is a critical aspect of our work at Health AI within the regulatory ecosystem. Which leads me to Professor Lim, your thoughts on the barriers that we see.
I think the key issue is a barrier of ignorance and lack of understanding. So the importance of education and stakeholders talking together is critical, because risks will always be there when you're either talking of a product or a service in healthcare, but we need to understand what is the nature of the risk. And I think one of the biggest barriers now is that the different stakeholders see risks slightly differently, even though they're fundamental core risks. So it's very important that we really talk about what exactly is the risk concern. But I think this whole issue of data security and confidentiality is critical, because if people don't really believe that either institutions or governments can protect this, then it's going to work against the further development of AI. And the other aspect that I mentioned earlier is that, in fact, healthcare professionals and regulators do need training and capacity building, because they themselves, actually I should say we, because I'm also a healthcare professional, we tend to be quite conservative. We look at the opportunities, but we are concerned, and especially in AI, when we're thinking of algorithms and large learning models and deep learning, we don't quite know what's happening, as there's a lot of self-learning going on. So I think that's even more critical to talk about what the real risks are. And even if we're very honest and say we can't manage them, then that helps the transparency, getting the people together and collectively working towards determining what is the degree of benefit risk. And we have to realize it's constantly evolving. So it's not something we can just decide today and say that's the situation. It will have to be an ongoing conversation, an ongoing level of education as well.
Thank you so much. And that last point is so relevant about the ongoing needs. Today you may be the most advanced regulatory agency in the world. As we've seen in the presentations, 6 months from now, you can be completely outdated. And so this is a shift in a way, the way regulators have to prepare themselves and addressing the knowledge gap, addressing the need for capacity building. So at Health AI, one of the things we do when we engage with countries is we start with what we call discovery training, precisely to build up that knowledge in parts of the world where it is further behind, so to say. And this takes me to you, Paul, with your experience from the UK regulator, understanding this ecosystem. I think you've addressed this partially, but maybe it would be great to detail a bit more the facilitators and barriers to seeing responsible AI become mainstream.
Thanks, Ricardo. I suppose that the first barrier I've realised today is not to speak after Professor John Lim, because he gives the answers that I was just about to give. What are the barriers? I think awareness, education, skills, and capacity for regulators are definitely is a big barrier. How can you handle millions of products, millions of applications when you've got most regulators aren't that well staffed around the planet? So I think that those are two major issues. So well done, John. You beat me to it. So I had to come up with a third one. So my other one, which I think is a barrier that it's not really, it's a bit of an elephant in the room type barrier, which is it was on my slides, accountability and liability. I think that's a really serious issue. It crosses so many boundaries. It crosses the professional boundary, the colleges, the professional regulators. It crosses the medical device regulatory issues, and it really gets into sort of privacy and societal aspects as well. And to my understanding, most of the landscape of medical device problems or medical healthcare problems when it comes to liability and accountability, it's very individualized. And it often goes after, one body or one entity. And yet I don't think that's the reality of the world that we're in with AI. I think, again, John's slide, you had all the stakeholders, like the IT companies, the developers, the AI models, the stakeholder participants that fed into that, the data governance of it all. I believe we're moving to a world of sort of having to work out better mixed liability, better ethical and responsible ways to handle that.
Well, thank you. And that's something we've been hearing both in the public and the private sector also. And the issue of who's responsible at the end is going to be critical. And AI will force us more than ever, I believe, to create bridges between those that develop the technologies, be it in the private sector or elsewhere, and those actually playing a role in the regulatory frameworks and developing also the legislation and so forth. If we want to get this right, we do have to work together. And that takes me then to Dr. Kim, coming from the private sector, a true leader in this field. How do you see the application of responsible AI? But most importantly, from your perspective, do you see facilitators and barriers, not only in your country, but also at a global scale?
Yeah, actually, I think, the AI technology is improved very, very fast. And as you know, the explainable AI system can gives us very trustful result for understanding how the decision or how the analysis in the data. But I think the AI technology changes very fast, but the regulation changes very, very slow. That makes really big barriers for us. As you know, all speakers says about the data diversity, and we feel the data diversity is really, really important for the training. But I feel the surveillance system is more important in the real world, because we actually well, conducting some clinical trials with a very well good data set that we're considering well all diversity of the we can sort, but well in real world there comes a really very various situations. So I think well to accelerate the application of AI for the medical field, I think well, this reliable surveillance system is really important, and all well the country or the government side has to prepare the kind of well, surveillance system for the AI algorithm, I think.
Thank you so much. I think the speed of legislation versus the speed of technology, that's a classic conundrum. But with AI, it's tenfold. I mean, it's something that we clearly need to address. And so building up capacity at the regulatory level and giving potentially more power to the regulators so that we don't depend on constant changes in legislation, having more blanket legislation that gives that power to regulators may actually be a need. And you also mentioned, and I'm happy for this, and I'm thankful for mentioning surveillance, because it is extremely important that we detect any challenges and problems early on before they become problems at scale. And this is a critical aspect of collaboration between public sector and the developers and the private sector. So at this moment, I would like to ask if there are any questions from the audience. This is the moment that you'll be able to ask all of our experts in the room if you have any burning questions of your own around the topic of artificial intelligence. The questions can be asked in both Korean and in English. We have a simultaneous translation. So if there's any question, this is a moment to raise your hand. But if not, we will continue. And you guys want to make me work, and I'll continue to work. And so I actually have many more questions of my own. The other question now, maybe now we'll start with you again, Dr. Kim. Looking at current legislations, what lessons do you think we can draw from the current legislations for medical devices when looking into the future application of regulations in predictive AI or generative AI in the field of health? Because you come from a company that develops a lot of medical devices, so you've been dealing with that. What lessons do you think we can take from that regulatory environment now looking into the future with all of these new Gen AI tools that are coming out?
You know, I think well, the generative AI can applying for the interfacing from the clinician and the patient and AI systems. I think this communication is really important. So well, I think well, we have to prepare some regulatory for the ethic check. By now, well, we just check about the safety or some this kind of performance, but well, we never prepared about the ethic check for the AI. So especially in medical field, I think well, the government or we have to prepare some method for the ethical problems in there, I think.
Yeah, the ethical conundrum is a big one, and that leads me to Paul then. I know a lot of discussions have been happening. I would say the regulatory environment is not there yet, but you coming from software as a medical device and coming from the AI regulation space in health, how do you see this Gen AI approach to regulation?
Yeah, so well, I think well, by now, well, our company just developed the diagnosis supporting system. In this kind of AI, well, I think the possibility is very low to make some ethical problems, because we just analysis the MRIs or CTs, this kind of images. But well, when we start to communicate with doctors, well, it comes some ethical problems, like maybe this problems comes from the data bias, I think, because some prevalence of the disease is different from the racial problems. But the AI has to analysis of very common senses. So this is the problem for us.
Thank you so much. And Paul?
Do you want me to?
Yeah, please.
A view in Gen AI. Generative AI is incredibly powerful. I think one of the issues is that there are some fundamentals of how the technology works that cause problems for medical devices. Generally speaking, I know we discussed medicines. Medicines have safety problems. They have adverse events and risks, but there seems to be something societally, human understanding, like no one seems really comfortable that your medical record could be made up and hallucinated. And depending on different techniques that are being employed, I'll hopefully speak to Dr. Yu later, find out what they're doing in NAVER, but even most of the technology still has this real risk, maybe 10-15%. Some studies have said up to much more than that, chance of having hallucinations. So for me, it's all about picking the use case. At the moment, there's a lot of work going on in summarizing of medical records. But if you've got a 10 or a 20% error rate, now it's not to say humans are perfect, and that's valid, but if you imagine a world that's going to rapidly accumulate the documentation of healthcare with a 10 to 20% error that only just continually adds. So I think we have to keep looking at that technology, see where that can be improved. But I think more importantly, we have to look at probably better use cases, more appropriate use cases. And again, it would come back to the sort of the benefit risk. And if you're in a scenario where there's nothing and this is an improvement, then we should probably focus on the use cases. I think because the regulatory side, the healthcare is always going to ask that, can you show me that it's robust and that it's safe?
Yes, this is a big ethical question that we hear around the world, especially in low and resource settings, where if we think about a village or a town in a low resource country where there is zero care, and being able to provide some level of care, understanding that it may not be perfect, that's an ethical discussion that needs to be framed in a regulatory ecosystem. And that answer is not there yet. And so this is the work that collectively we need to work on. And also making sure that these technologies have a checks and balance system in a way, where the human in the loop right now is still critical. And this is another discussion that we've been having. And a lot of these technologies, despite the confabulations or hallucinations, we see that they do many times produce in specific niche areas very impressive outcomes. But also many studies are showing that the combination of humans plus AI can even improve even more. So that symbiotic, thinking of the healthcare workers of the future being more of cyborgs, if we will, of that integration and symbiosis between machine and humans, will force even medical universities, healthcare workers, even in pre-grad, to rethink the way we're training healthcare workers of the future. What is the role of the human in that health system, and what is the role of AI and Gen AI, and how do we create that regulatory ecosystem? So that's a perfect segue for you, Professor Lim, in the sense that coming from your university, say, I know Singapore is already having conversations around how do we deal with Gen AI. Your thoughts on this issue, please.
So I think if we think of the whole regulatory ecosystem, and Paul actually mentioned this as well in a slightly different way from the way I presented it, we cannot look at silos and just say, medical devices and software as a medical device is regulated by the health product regulator, and the issues that flow into institutions and healthcare practice are regulated by the Ministry of Health. So I think when you're thinking of this in terms of the broader aspects of regulating AI, whether generative AI or other elements of it, we have to change the whole regulatory framework actually in our countries. So this convergence, I think, is quite critical because the way we're currently set up mitigates against the conversations across the system it's not just a life cycle anymore, it's across the whole system in the terms of which AI is deployed. So I think that's a fundamental thing, which, as I mentioned in Singapore, we're really going to try and do this within our healthcare system. So I think that's the first step, which other countries also have to think about. And the whole aspect of the human in the system is very essential at this point in terms of not just addressing the risks of generative AI, but building up trust and addressing the concerns, because actually they're different sides of the same coin in a way, that if you can't address that, you can't manage the risks either. Because the healthcare professionals have to be very much part of that. And if they feel that they can't trust the system, they can't be part of managing the outputs of what AI tells them, then I think at this point, at least in our history, we can't move further. I mean, when you talk of moving towards cyborgs in the future, well, I think if you say that too soon now, you'll make everyone a bit afraid and get pushback. But I understand what you're saying, but I think probably at this point, if we talk about humans interacting with AI to manage the risks, including generative AI outputs, then I think that's probably what we should be doing at this point. And just a final point, that little highlight I mentioned in my talk, I was very intrigued by this study by one of our medical schools in Singapore, which highlighted that the older, experienced healthcare professionals were more comfortable dealing with healthcare AI than younger doctors, younger nurses, younger pharmacists, simply because they did not have that level of experience to interrogate the outputs of AI and question, is this a hallucination or is it valid? So I think that's also important to note.
Well, thank you so much. And you touched upon so many issues, but I'd highlight the inclusion of healthcare workers in developing the frameworks. Because if the healthcare workers do not trust the regulatory models that are put in place, then you have a barrier in terms of adoption. And you need that feedback also to make sure that you're creating something that is useful for the real world. And you did mention in your presentation this concept of older, or more experienced healthcare workers being more comfortable in using AI, seeing it as a complementary component to their work that can help them in their work, knowing that they have the level of knowledge to identify potential risks more than the younger generation, which I find as a sign of hope that the younger generation doesn't think they know it all, which is not always the case. But when you said that in the presentation, I saw my colleague Paul Campbell moving around in his chair. So I'm going to put you on the spot, Paul, because would you like to comment on that particular aspect? And so we'll get to you in a second. But on this issue about the older part, the more experienced workforce being more at ease, so to say, with AI.
Absolutely. So thank you. Thanks, Ricardo. My laughter comes from being a clinician. You know, I was a clinician for 2 decades, and I think about things clinically as well as regulatory now. And I understand that conundrum, I understand why. And I think there's been other similar studies. There's been some in sort of radiology imaging would have done, like, you know, very junior radiologists, sort of reasonably experienced radiologists, and very experienced radiologists, and they all perform differently when they use AI as well. So there is something about that level of experience. It equates to sort of automation bias issues with using technology. You know, we're innately driven to more or less believe what's on the screen, and then that you believe what's on the screen even more depending on the context of what you're in. If you're in a busy society, you know, busy emergency room, an overburdened healthcare, or a waiting list of patients outside, it becomes easier to believe things. So I'm really pleased to see that, you know, junior, you know, clinical colleagues are saying, well, hold on a minute, we may not know, and we're not so sure about that. So I think it makes a lot of sense. It's understandable, and it fits into an even longer term problem of like feeding this into sort of undergraduate curricula, because, you know, trying to get something into the clinical undergraduate curricula is a long journey, but we need to teach and train people about things such as automation bias and why they should quite rightly question that. So I'm glad your colleagues are questioning it.
Oh, thank you, Paul. And this takes us then to Dr. Yu from Naver Cloud, which has a business model that has truly had impact in the world, and particularly in Korea, but beyond your borders, with the use of Gen AI also. Looking at the future, and as Gen AI becomes more and more prevalent in health systems, how do you see the regulatory needs evolving? We've heard people discuss potential need for clinical trials, The head of your competitors at Google in the regulatory affairs was saying the other day that we should test Gen AI the same way we test medical doctors. That's another approach. All of them are not, I would say they're controversial. They're not consensual. What is your take on this?
I strongly agree with the competitor in the Google because generative AI is more like human-like, has human-like output, so it's very difficult to evaluate each outcome from generative AI with respect to the classical machine learning system. So maybe it is nearly impossible to evaluate every output of generative AI in the field. So maybe we can have some post-surveillance system with human feedback, but humans are sometimes too busy to dig into the result, and it's not enough to qualify the result in the field. So as the example in Dr. chart, maybe my chart in EPIC, humans are easily to be lazy to evaluate the result of AI and just deliver the outcome to the patient without any qualification. So I think we need to see the AI more as medical step rather than just a deterministic machine. And the other fact that I think important in regulation is in generative AI era, many companies are depend on a core technologies from other companies. That means many companies will make their generative AI-based medical device based on Google's or Naver's or other big tech's foundation models. So they have limited to access the core technology, so they cannot expect the detailed and accurate results of using foundation models. Maybe minor update of big tech's foundation model can affect very, very critical change in the field. So we should consider that too. And the last thing is, I think, interaction with generative AI. Okay, let me rephrase my thing. Collaboration with human and AI is also be considered in the effectiveness of medical device in Gen AI medical device, because before the Gen AI is more like an exploration tool of knowledge rather than giving a deterministic answer. So exposed to the result of generative AI can help medical doctor a lot. But if we do not consider that effect, the capability and potential of generative AI-based medical device shrinks a lot. So maybe we should make another measure or consider the contribution of collaboration effect of generative AI. Thank you.
Well, thank you so much. And that's a lot of food for thought. What you said, I would say, is not absolutely unanimous in the world, which is good because it means we have a serious conversation to lead. But I agree with you that we have to have a different approach to Gen AI if we want to maximize it. And I think a part of what you said is consensual, is the need for post-market surveillance. That is clear. How we're going to assess the technologies is something we clearly need to work together between the developers and those regulating. But you raised a very important issue that we don't talk enough about. Those working in the VC world and in the investment world in technology know that most of the things that are being presented as Gen AI are actually built up on top of one of the foundational models like Naver's. And so in reality, who are we assessing, right? And then there's the issue, who is responsible? The liability issue that Paul alluded to if something goes wrong, right? Yes. And so, yeah, well, we're at time, but if you want to comment quickly on that.
No, go.
No. But so just to say, I mean, these are open questions that I think are very important, and that the fact that we have companies that are building foundational models like yourselves that have put security threats and responsible use of AI as a top priority, I think is extremely important for humanity. And so our gratitude to you and our gratitude to all of our speakers here. We've reached our time. The last question I had, we won't have time to answer, was what should governments invest in with regards to knowledge and resources to facilitate and implement responsible AI in health ecosystems? Since we don't have time, I'll give a quick answer, which is governments should work with Health AI, which is the global agency for responsible AI in health. We were very proud to be part of the World Bio Summit, very grateful to the government of Korea for their kind invitation, and extremely grateful to our amazing speakers who fostered, I would say, the best session at the World Bio Summit until now. It was the first one, but it was certainly the best. So thank you to all of you, and a round of applause for them, please.
Thank you.
Good afternoon, everyone. Please have a seat. Now we will be starting very soon. Actually, I think we can start. First of all, thank you so much for everyone for coming, especially looking at the 4 simultaneous sessions coming in. I think we are one of the winners. but very thank you, and I promise that it won't disappoint you. It'll be a very exciting and also inspiring session. We have a very good line of speakers, panelists, eminent delegates in the room. So we have a very packed schedule today. We are trying to hear as much as possible from our partners. So without further ado, I would like to invite Dr. Eduardo Banzon. He is the Director of Health from the Asian Development Bank. So I'll give the stage to you, Dr. Banzon. Thank you very much.
Sorry. Okay. Good afternoon, everyone. So I sort of missed that time because I was listening to the biosimilars discussion in the other room, and I always find biosimilars to be an exciting one that hopefully the advance will also support eventually. But nonetheless, let me welcome you to this side event. Of course, thanks to the Korean government for bringing us here. So here, we'll be launching, in a sense, something which we always talk about in ADB. The pandemic was only 4 years ago, and sometimes we feel like the world has forgotten about the pandemic. The pandemic has gave us a lot of lessons. For us, it changed the whole world. It changed even how ADB works, because it actually has expanded what ADB engagement in the health sector. And now ADB is sort of we're very good in roads and energy plants, and power plants and all that, but we're now becoming very good at health. And so we now see this opportunity for us to build on the lessons of the pandemic, to make sure that the lessons that we've learned, the actions that the world took, in Asia in particular, will not be forgotten, but we're going to build on that. And this is for this reason that during the pandemic, we in ADB work with a lot of national regulatory agencies. We call it RVAG. We work with countries. We help them procure vaccines. We engage manufacturers, both from the public side and the government side, and try to see how we could help them strengthen their manufacturing capacity. We got to work with regulatory agencies, so we could provide technical assistance, provide them with intelligence, provide them with whatever they needed to strengthen them. We work with the private sector, and that's one strength we have. We ADB, as an international organization, we work closely with the private sector, so we could get to fully understand what was in the future, what was in the pipeline. And of course, we work with a lot of think tanks and all that. And we see that, I think sometimes the problem is when there's different players, NRAs, manufacturers, governments, think tanks, don't talk to each other. We're missing a lot. We're missing a lot of opportunities. So we at ADB said, no, why don't we, since we are considered an international organization, an institution that people can work with, we will informally get everybody to work together in what we call the Asia Pacific, and this is what we're launching now with the Asia Pacific Diagnostics, Vaccine, and Therapeutics Network to counter epidemics and other disease outbreaks. So the ambition clearly is huge. But we see this as a platform. We see this not to replace our friends from WHO. I think there are friends from WHO here. Not to replace existing networks of NRAs, that's where our existing platforms, organizations of manufacturers working together, but rather as a platform, a venue for common-minded people, like-minded people like all of us, to see how we could all contribute. And of course, we bring in something new. We are a development bank. You don't usually see us in discussions like this. And we also bring in new resources that's a little different. We're not a grant-giving organization like our friends from Wright. We are not a usual vibrate bank. We are a development bank that can actually provide and mobilize resources to help developing member countries to make sure that when the next pandemic happens, we will no longer hear countries in Asia and the Pacific talk about vaccines were not there, diagnostics were late. I always love to say one of the things that actually got me so angry during the start of the pandemic is when there were countries who decided not to export face masks. That was just amazing, right? something so simple, which is a face mask, because they say they're running out of face masks. So the manufacturer decided not to export. If something as simple as face masks can be stopped during a pandemic from being sold to other countries, imagine. And of course, we don't have to talk about, I think all of you know what has happened eventually. So hopefully we'll have a very productive discussion, and we welcome and we thank you for joining us in this launch of Advance. So we have a nice name. So we want to advance, and we look forward that after this, we'll have more constructive and So I now give the floor to Jay. Thanks a lot and welcome.
Thank you so much, Dr. Banjong, for the very inspiring, welcoming remarks. Really, it's a partnership. We can't just do it ourselves. And we have all those partners here, from governments, NRAs, MOH, academia, development partners, everyone. So I hope it will be a really richful conversation here. And then for the next presentation, I would like to invite Dr. Dinesh Arora. He's a principal health specialist from our team. And he'll be giving a presentation on setting the scenes, on strengthening vaccine therapeutics and diagnostic manufacturing and regulatory oversight in Asia Pacific. Dr. Dinesh, please.
Well, thank you so much, and good afternoon, everyone. I know sessions after lunch are difficult, but I'm sure this big crowd here just shows me that there's a lot of enthusiasm. What made ADB go into vaccines and regulation? Let me give you a context here. We had, during COVID, countries asking for vaccines. ADB was flushed with money because Philip is sitting here, our procurement guy who leads this. $9 billion we earmarked for vaccines for developing member countries. But we could not procure vaccines because WHO EUL was not there still. And what is the guarantee a bank takes that the vaccines clear the triple test of safety, efficacy, and quality? Now, this is where we were struggling, but we also felt that the countries required some kind of a hand-holding. We are not experts on this. We are a bank, right? We scale things up. John is looking at me and saying, why Dinesh is talking about all this? Because we needed partners here. And that's why, can you go next slide, please? We went with something called Regional Vaccine Advisory Group. 4 years down the lane, Ben was one of the founding members for this. We said, can we bring a platform where the national regulators could guide countries of how to go about vaccine procurement and vaccine supply and delivery? And this is where Dodo has taken this initiative of coming up with Advance, which is perhaps one step ahead of this, of why only regulators, but also perhaps manufacturers, DMCs, the private sector, all coming together, think tanks, academics, to come together, share things, and move forward. So perhaps I'm preempting one question from my moderation discussion is, what was one of the biggest lessons which we took was weak regulation in many countries, which was preempting us not to provide vaccines. Can we go next slide, please? I will just give you one example. In fact, a couple of examples I had. We had a country X who said, look, we have procured vaccine Y, which has been cleared by WHO. Now, please reimburse this cost. Now, that vaccine was a multi-dose vaccine. WHO had cleared only a single-dose vaccine from the same unit. Can we finance that? Is it under contract manufacturing? The answer was no. But then, who is ADB to tell DMCs that, no, this is not the same vaccine? So we faced a backlash from the country X saying that, look, guys, 1 dose, 5 doses, same thing. What's wrong with this? Same vaccine, same manufacturer. Now, we went tell them, no, there has to be an adjuvant, there has to be a new preservative. These are different vaccines. It couldn't help. So at that time, when we roped in RVAG, we had Australia TGA head and WHO coming and presenting to them that, look, multi-dose vial vaccines is different from single dose. And in fact, it's under scrutiny, and very soon we will have the approval. And it happened like this. So we need some credible voice across Asia Pacific which could support us. But Advance is going one step beyond it. Here we are talking about not only advice, but how do we support your increasing regulation? Core NUS, Syed are sitting our partners who are helping us in doing strengthening regulation in Bangladesh. Similarly, what about newer challenges, climate and health? Do we have regulators today with capacity to say, hey, if you are doing health insurance or doing reimbursement, let's have an implant which has less carbon. Let's have medicines, therapeutics which are less carboniferous. I don't think so we have that capacity. And this is perhaps where we are trying to come up with more emerging topics on these issues. And of course, how do we pool the demand, come together and use economies of scale and get prepared for the next pandemic? Next, please. I'll take a couple of slides on what ADB is doing in Bangladesh. Can you go next, please? So this is what Dodo and Jay were mentioning initially. The vision is all ADB members have the fastest possible access to essential medical products. We talk about vaccines, therapeutics, diagnostics, with regulated safety, efficacy, and quality. Next, please. The functions will be to exchange information, contribute to strengthen regulatory capacity, eventually leading to enhanced preparedness and capacity, and also increasing costs of economy, using economy of scale to generate costs which are much more feasible and sustainable. We are also talking here about not only vaccines during pandemics, but even adult vaccines, adult vaccination which is happening across the world, and also having manufacturers and international organizations as part of it. This is more of a network rather than any formal alliance we are saying, but a network and a platform which can make all the key stakeholders come and share information. Next, please. 2 slides on what we are doing in Bangladesh. In Bangladesh, we are providing a roughly about $388 million financing to set up a manufacturing unit within a state-owned enterprises. Can you go next slide, please? How do you decide to finance a manufacturing unit? We have seen during H1N1 Ebola, the glut of manufacturing units. Does the market study feasibility suggest we can manufacture vaccines everywhere? No. The answer is, 1, you should have a longer, bigger internal market like Bangladesh has. 3 million birth cohorts every year. They are right now dependent on Gavi. I have Sushant here, but they will transition out very soon in 2029 from Gavi. So what do we do? Sorry, Faisal from Gavi, sorry. So what do? We have to have a plan to see when Bangladesh transits out, it doesn't spend its foreign exchange only in buying vaccines at a higher rate than where it can produce. The market is ready, ingredients are ready, manpower is there. They need to strengthen their regulation, which we are also supporting. And perhaps the lesson which came up in pandemic was self-sufficiency to a greater extent. Can we have one manufacturing unit fully functional, which can be repurposed during pandemics and start preparing vaccine which is required there? This should have both the technologies of conjugate, but also the newer technologies of mRNA, which we should bank upon. So in this, Bangladesh has a roadmap. We have our colleague from Bangladesh who will be presenting. They have passed the Bangladesh Drugs and Cosmetics Act, which we were also part of them, IP Act. We are part of the Institutional Development Plan, which DGDA, the regulator, is doing. So very soon, the work we will be setting up the unit, and perhaps the first step will be to move towards fill and finish of certain key vaccines. Next, please. Similarly, as I mentioned, manufacturing and regulation go hand by hand. There was a time where in country X, when we were supplying vaccines, they were not even competent to issue letter of content, letter of analysis of those vaccines. The release letter could not be done. So we had to depend on either a neighboring country to what we call as regulatory harmonization to get that letter released. But I think it's important every country gears up for quality. And perhaps these are the few important things which we picked up. We're also supporting Bangladesh in setting up of a national control lab, their human power, and also their post-marketing surveillance as they produce their own vaccines. So that's what we are doing in Bangladesh as part of our manufacturing and regulation. The idea here is that we pick up a country which has a feasibility to manufacture vaccines. The idea is also to export vaccines, but then that could take a few years, maybe 10 years down the lane. Could we have a project coming up which just solely depends on exports? So some of the countries are those which can actually immediately go for vaccination. The second country is Pakistan. The birth cohort is about 5 to 6 million, double of perhaps 1.5 times of Bangladesh. They're also graduating out in 2032, most likely. That's a plan they have. I'm sure we are also working with them to see what plans they have when they are transitioning out of Gavi subsidy and how do they have vaccines available. Now, vaccines are not only for childhood vaccines, but also for adult, also for antimicrobial resistance, also for newer diseases like malaria, dengue, TB, the newer vaccines which are coming. And we will be marketing to all those vaccines as part of Advance. In Advance, we come forward for having a market for manufacturing vaccines where we provide the support to the countries, get the best stakeholders across countries on one side to get the best advice and move forward. I'll stop here. I think I'm within the time. And thank you so much, Jay.
Thank you so much, Dr. Dinesh, for setting the scene. It really helped on being all of us on the same page. And I forgot to mention to thank the people online who is watching this session in the YouTube live stream. So thank you for watching as well. So for the next sessions, we will be having 4 panel discussion in very interesting sessions that Dr. Dinesh and Dr. Banzon has mentioned. So the first panel discussion will be on supporting vaccine therapeutics and diagnostic manufacturing and technology transfer. And we will be having a section on regulatory capacity building, regulatory harmonization and convergence, and the procurement of vaccine therapeutics and diagnostics. So I would like to first invite the moderator for the first panel discussion, Dr. Dinesh Arora, and the panelists to the stage. You can have a seat over there at the chair. So it'll be Mr. Faisal Giliani from Gavi, Dr. Hani Kim from Right Foundation, Mr. Mujahidul Rahman from EDCL, Bangladesh, Dr. Sushant from IVI, and Mr. Syed from Tech Convention. So welcome, everyone. Please give a big hand.
Well, thank you, Jay. Hope I'm audible. Right, I think this is a very distinguished panel. I have on with me a country representative from Bangladesh who is actually going to implement manufacturing of vaccines. We also have our colleague from the Director General of Drug Administration with the regulator. Thank you so much, sir, for being there. Hani, you are a global name today when we talk about technology transfer, right? And how do we handle the manufacturing of vaccines with the newer technologies? I'll come back to you on that question. Sushant, thank you so much for coming again. We had met at Singapore, and we look forward to your guidance on how we work together and moving forward. Faisal, I think Gavi has done a phenomenal job so far. But how do we work further is another question I'm going to ask you then. And of course, Syed. Thank you, Syed, for being our partner in our journey on vaccines. I think, Faisal, you have to leave early, so I'll choose on that. What measures are critical to advancing manufacturing capacities for vaccines in Asia, as I showed you for one country, but how do you ensure pandemic preparedness for future health emergencies using vaccine as a tool? Thank you.
Thank you, Dr. Dinesh Arora. When you were speaking, I thought Gavi is speaking up on the stage on all the vaccine manufacturing, pooling resources, demands, and investing. So you have, I think I have to now reduce my
I hope you're not saying that I copied your slides.
So thank you so much, and it's a pleasure to be here today. I would like to be as brief as possible, but one step back, Gavi, the Vaccine Alliance, was created in 2000 to address the inequities for life-saving vaccines. So manufacturers were only manufacturing for higher prices, low production, but Gavi was created to address this and ensure that vaccine reaches the low and low middle income countries around the world. Fast forward, we have immunized 1.1 billion children in last 23 years, saved 18.8 million lives, or we call it deaths averted, through immunizing and contributing $220 billion of economic benefits through this support to 78 countries around the world. Gavi is not a charity model, I must say. It's more an empowerment model where we encourage countries to co-finance and also transition out. Danish mentioned Bangladesh is transitioning out, Pakistan is transitioning out, but 19 countries have already transitioned out for this support. And largely it comes to the market shaping. I think that's the topic I've been given on how Gavi supports vaccine market shaping and what are the key steps needed in post-pandemic COVID pandemic. The pandemic has pushed us back and let us realize where we are heading and how we can address some of the challenges. The first key lesson learned from COVID pandemic is the lack of financing or surge financing. This is something Gavi has worked together with our partners and donors and multilateral development banks. We are in discussions with Asian Development Bank and hopefully signing MOU later this month, is to provide financing for such pandemic situation. So we have now set up a day zero financing facility with $2.5 billion to made available. Out of that, $500 million is a first response fund. And within weeks of announcing it in June, after our board meeting, we were tackling the Mpox and immediately allocated or even signed a partnership with vaccine manufacturer in Germany, Bavarian Nordic, with $50 million surge financing to secure vaccines for affected countries in Africa. So financing is the first major requirement to tackle any such situation or pandemic. The second lesson learned was regional vaccine manufacturing. So how it could be broadened. This is one of Gavi's core competencies or work. When Gavi was launched, we had only 5 WHO pre-qualified manufacturers around the world. And one of them was in Republic of Korea back in 2001. And fast forward, we have now 19 WHO pre-qualified manufacturers around the world in 12 countries, and 10 of them are in Asia, and now 2 in South Korea. There are many, but the ones we procure from. And even in South Korea, almost 99% of our oral cholera vaccine is procured through EU Biologics in South Korea. And we spend almost $100 million a year procuring vaccine from the country. In light of COVID, we also launched a regional vaccine manufacturing initiative, how we encourage countries, regions to come forward and ensure the adequate supply. We saw the countries closing their borders for vaccines export and so on when COVID struck. So our first such initiative was launched on 20th June in Paris during our next 5 years investment opportunity, where there's about 7 donors came together and pledged $1.2 billion to launch the African Vaccine Manufacturing Accelerator, where we are pooling these resources to support manufacturers, public or private or joint, in Africa to come up with their own vaccines. Currently, Africa has 20% of world population, but only 0.1% vaccine production or contribution towards the globe. And African Union has set up a goal of having 60% of their needs covered by 2040. And Gavi is very much behind these initiatives to support. So we will, combining these two, we're really looking forward to MDBs like Asian Development Bank or Islamic Development Bank and others who have, or AIIB, to come forward with countries to provide financing. You're already working on that. It was music to our ears. But also encouraging manufacturers to come forward and play their share for to reach the vaccine to every child or every human around the region or the globe. Thank you.
Thank you so much. I think we can clap. If we shouldn't be so miserly with the clap, please. No. Absolutely, Faisal. And while you really spoke about the pandemic preparedness and the financing which Gavi provides and which MDB is also pitching, we're actually also looking forward through their MOU, and I think Dodo is here, of how do we support countries when they're transitioning out also. I really love the word when you say it's not charity, but empowerment. So I think ADB is also will be part of this journey through Advance, where we want to empower the countries when they transition out of the Gavi subsidy and move forward. But thank you so much for your intervention. Dr. Hani Kim, if you have vaccine manufacturing, as we discussed, how do you see technology transfer in building self-sustaining health systems that can respond to future pandemics?
Thank you, first of all, for inviting myself to represent Right Foundation for this important discussion. So to answer that question, I think we need to sort of step back and think about what the essential building blocks of self-sustaining health system are. And two critical components of the six building blocks are, first of all, personnel. So we need people, and we need skilled people that could actually develop and make available essential health technologies, essential in the sense of what is needed to protect that particular population. So what does technology transfer do when we think about what role it can play? As many of you in this room understand, technology transfer is just not a matter of handing down a recipe or experimental protocol to somebody. It actually requires a commitment to educating and training, to upskill and reskill. So as we engage in technology transfer, what the act of doing so, what that translates into doing, is actually to reduce the gap in the level of knowledge that are currently concentrated in a handful of countries. I think Faisal mentioned, and back in 2001, only 5 companies had ever pre-qualified vaccines. So we've learned during the pandemic, and this has been recently reported by WHO, that health inequity is rooted in concentration of resources, both material resources and immaterial resources such as knowledge. So tech transfer, when done right, and I would love to see another session next time that's focused on how we can learn about doing tech transfer right. I think we don't understand what that looks like right now. So if it's done right, it has that potential to contribute to reducing the gap in the level of knowledge that's necessary for R&D, for essential health technologies. And if we achieve that, then it has the potential to reduce the reliance of the countries that are relatively resource constrained, or, to be blunt, to be deprived of material resources on other countries that are wealthier. So those are the roles that I see that tech transfer can play in supporting self-sustaining health system in the long run.
Thank you, Dr. Hani. Absolutely, resources as well as tech transfer, they both go hand in hand. And happy that we will be working together to understand how Advance can take it forward, and Right will be an essential member for this. Thank you so much for the same. Now let me turn to a country example here. Dr. Mozahiuddin Rahman, he is the Deputy Manager for Quality Control, Bangladesh, from an Essential Drugs Company Limited, which is a state-owned enterprises. Now this has manufactured IV steriles, antibiotics, penicillin, but not vaccines. But this is the big step which the company is taking. And we have a middle management represented today, the one who actually work on the field, the one who actually represents how a company can be upgraded. So maybe Dr. Mozahiuddin, if I can ask you I think you have a small presentation to make on the Bangladesh project. And perhaps my question to you will be, what are the challenges you foresee in maintaining the quality and coming up with the manufacturing of the vaccines in a state-owned enterprise like EDCL? Thank you.
Thank you for your question. Thank you for inviting me here. I would like to thank all of you and the organizer also. And actually, I am the team of project management, and during COVID of Essential Drugs Company Limited, actually. It's a fully government pharmaceuticals company in Bangladesh. And we are doing more about 70% of our medicine have consumed by Bangladesh people. Most people are consuming our product. And Dr. Dinesh already told all sort of things. Actually, EDCL management, if I come to the question actually, EDCL management faced challenges in getting technical assistance to develop this project actually, focusing especially on the areas of quality control, I mean the manufacturing quality, technology transfer, regulatory advisory services especially, and process optimization, in a whole total biopharmaceutical strategy. So moreover, our project is going to be WHO pre-qualified, and of course the facility will be a WHO approval. That's our goal actually. So in do that, I'm going to present my presentation. Is it okay?
Yes, please go ahead.
Oh, sure.
Next slide, please.
Thank you. That's the vaccine therapeutics and diagnostics mission and vision. It's increasingly more and more drugs are being produced from biological sources, especially ranging from purified proteins to revolutionary gene therapeutics. At EDCL, we aim to build our capacity across board with particularly focus on protein vaccine and mRNA technologies. Protein vaccines can be produced from design to vaccination stage within 100 days, but the key is to choose the optimal technology. Next, please. During COVID, we have seen that political alignment is of paramount importance. Sharing research findings, data, and insight is critical for evidence-based policy making. To fight against unknown biological enemies, regional and global collaboration will be the strategical weapon to track and fight against future health emergencies. Next, please. As soon as the outbreak is declared, we must have the right platform to address the issues. The SSB approach to vaccination emphasizes a rapid forced strategy for implementation and aiming for rapid herd immunity also. At EDCL, we expect and hope that a fruitful collaboration of technology transfer and innovation can be done with global partners. Next, please. Vaccination plays a crucial role in biosecurity to prevent the spread of infectious diseases. Historically, Bangladesh has done very well for vaccination, mainly due to constant supply by Gavi. But by 2029, as Dinesh mentioned earlier, Gavi will be stopping such support, and we must build our own capacity. Next, please. Already a couple of our private biopharmaceuticals have produced vaccines, and our local authority, Drug Administration of Bangladesh, DGDA, providing them marketing authorization. And hopefully, by strengthening the DGDA project also, as Dinesh mentioned earlier, we're going to have a better opportunity for our people, for our country betterment, to implement this project, this VTD project actually. Thank you so much, and thanks you.
Thank you so much, Mr. Mozahuddin, and I also acknowledge the presence of my colleague from DGDA, from the regulation side. Thank you. Dr. Sushant, what do you think governments, now you've seen a presentation from a government representative here, what is required to support government initiatives for increased R&D and sustainability? How do we get the latest vaccines for them? Thank you.
So I think I have some slides here. Was there a? Yes, thank you. Yes, yeah. So again, thank you so much for inviting me here. So what I will do is probably this will be two-part. First, I will go through the presentation to give the context, and maybe after that I can respond to your question, Dinesh. So as Dr. Benzon basically mentioned, right, we have already forgotten about the COVID-19 and what was the impact. So this is just to remind that we are only 2 years into this catastrophic event that has happened everywhere. And then if you look at the rates, the dates, as well as the number of cases, there are various projections about that, but anywhere between 7 million deaths to about 18 million deaths so far. What is more important is beyond the number of cases and number of deaths, we also need to think about the financial implications of COVID-19 pandemic. And I think there are, again, various projections as well as various calculations for this, which goes anywhere between $4.4 to $5 trillion effect on the economy in 2020, 2021 to about 91% of the global GDP, which comes to around $137 trillion. So that impact is quite huge beyond the life as well as lives lost as well as the disease affecting. We need to also think about what has been the financial impact of this particular pandemic. So if you have to think about taking a backseat and what exactly has happened during COVID-19 and what should be the lessons learned as well as the inequities that were there during COVID-19 pandemic. Initially, for vaccines only, I'm not talking about the whole ecosystem here, but for vaccines as well as for taking care of the future pandemics, there are 5 major areas which we think there was a bit of inequity. Diagnostics. We did not have proper diagnostic in many of these countries where COVID-19 was first started to report. And then if we cannot measure the outbreak, if we cannot measure the disease, it's very difficult to plan for those things in these countries. The second point is about research and development funding. I have a separate slide about that. It's about absence of research and development funding in some of these countries, and wherever it's available, it's a disproportionate use of those available funding for certain specific players. Third is manufacturing, and I think this is something that we have acknowledged, especially in Africa. The manufacturing is lagging behind, and I think there is a plan by 2040. They want to be 60% self-sufficient. So what can be done for those moving forward? Fourth point is about vaccine supply. And yes, there was COVAX. Obviously, it was not a perfect model. There are a lot of things that we can learn from that model. But can we develop something which is more practical moving forward? And can we be ready with that? That's something as inequity that we see. Fourth part, or the fifth part now, is the vaccination. Actually delivering those vaccines which we need for the countries to prepare for the outbreak control. Now, coming to the research and development funding, if you see during 2021, there was about $6 billion. And as Dinesh mentioned, there was $9 billion at ADB for procurement of the vaccine. If you see, and this is only for research and development funding, only 5% of that was essentially given to the developing country vaccine manufacturers network, which is about 47 different manufacturers. And they actually, in the end, produced 60% of the vaccine that was supplied globally. So it was not essentially the lack of funding, but more about how do we proportionately distribute that funding to the right players to make that impact. I think we should think about that moving forward. But all is not bad. What we see on this slide is we have ramped up the facility for global vaccine manufacturing quite rapidly during COVID-19. From December, if you see here, 2020 to about August 2023, we have increased our capacity for only COVID-19 manufacturing to about 14 billion doses, which is huge. And the question also comes, what do we do with that enhanced manufacturing capacity that has been developed in all those countries? On one side, we are increasing the global manufacturing capacity. On the other side, we also are getting a lot of these new manufacturing units being developed in different parts of the world, especially in Africa. So I think how do we manage the increased capacity is something we need to think about. Now, what are the enablers of the ecosystem that we essentially work on the vaccine field? So if you see, there are 3 areas: technology, regulatory harmonization. I think this is a theme that is coming recurrently, and we need to really think about that, and establishing the frameworks. So what do I mean by technology? early access to the technology to some of these manufacturers is going to be the key. IP and know-how. We know that for mRNA vaccine, getting the LNP is going to be something which is a critical piece, which is missing right now under the IP. So what can be done, especially for the manufacturing capabilities that are being developed in African continent? Tech transfers. I think this is a common theme, again, as Hani mentioned, as Dinesh mentioned. For regulatory harmonization, national health policies, how do we integrate that with the reliance mechanism between different NRAs and collaborative reviews between different NRAs? And again, for framework establishment, it's about the PPP, flexible financing, and governance and coordination. So there are a lot of things which are mentioned on this slide, but really what we need to think about for the next pandemic is the holistic view of all these points. And essentially, I have highlighted the last point, which is building sustainable academia, industry, and government partnership, the PPPs. Also, there is a good progress on the pandemic agreement now, but can this be implemented at regional level in Asia, for example, or in Africa? The speed and scale of manufacturing, can we achieve that? For COVID, we got about 250 days to get the first vaccine out. The good news from Rwanda for the Marburg vaccine, within 12 days, the vaccine was essentially used in a research environment, but can we do something better for the 100-day mission? And then investment in capacity building is going to be a key. Plug and play vaccines, I think we need to think about that, but again, there are serious limitations for mRNA vaccines because of IP and few other things that we need to think about. And then just to reiterate the point that global health actually intersects with almost all of the sustainable development goals that we are talking about here.
Thank you so much, Sushant. It's amazing, and I think this also sets the agenda for advance, you know, those are 5 things you were mentioning. But be careful, Jay, that when we talk about VTD, normally vaccines take the whole floor, and we just don't talk about therapeutics and diagnostics. So I think Dr. Benson started with his word diagnostics and face masks. So let's not forget that it's VTD, vaccines, therapeutics, diagnostics. And of course, then you did speak about the manufacturing and then also the procurement. And we actually have a session on the fuel procurement and then about the vaccine delivery. But we are still missing one element, and that's animal health. Now, nobody is speaking about animal health. We all know that animal health affects human health. One Health is based on this principle. How do you eliminate human TB when you have so much bovine TB and the interface is so loud? So let me now ask Syed, who represents private sector here. He's been also supporting ADB in different projects capacities. So maybe Syed, over to you. How do we initiate a discussion on animal health, vaccine? How do we take forward? And I'm giving this context because Dr. Benson, our director, was in India, and the Niti Aayog member, who's at the rank of a minister, actually requested ADB to say that, what are we doing on animal vaccines? Can we take some leapfrog on the animal vaccine side? Thank you.
Thanks, Dr. Dinesh. We have an initiative called the Global Collaborative Center for Medical Countermeasures. We've done this after discussing with various stakeholders across low-middle income countries. And we've also discussed with our regulator in India, where we said, can we look at human and animal vaccines in one center, given that all platform technologies are by and large applicable to both segments, but of course, compliant with all the necessary rules to prevent contamination, validation, cleaning, and so on. So we are in discussion with the Indian regulator on that. I have a 4-minute video to talk about this new initiative. Can I have the video, please?
In a world where superheroes are celebrated for their strength, vulnerabilities do exist, hindering them from reaching their potential. Similarly, in the realm of translational biotech research in healthcare, the Centers of Translational Research Excellence strive for scientific innovation, but encounter challenges in GMP scale-ups with regulatory approvals. Furthermore, we must consider the obstacles encountered in technology transfer, particularly in low and middle-income countries, to facilitate local production. TechInvention's proposition at the Global Collaborative Center for Medical Countermeasures, GCMC, is to establish close collaboration with these centers of translational research excellence for technology development and transfer. At GCMC, the scope will encompass disease and target identification, as well as the use of advanced AI/ML and computational biology tools for biosimulation. It will also include GMP-based cell banking, the development and characterization of cell lines, the selection of suitable platforms for implementing countermeasures, the initiation of shake or spinner flask experiments for USP, followed by DSP, process optimization, and validation for scaling up to produce GMP batches for preclinical and clinical studies, and the provision of regulatory approvals for these activities. These validated, IP-secured, and regulatory-approved technology packs will be facilitated for transfer to existing manufacturing hubs, along with gap analysis, bridging, or to new facilities that will be set up, which is also a core expertise at Tech Invention. Located in the financial capital of India, Mumbai, GCMC is set to emerge as the world's one-of-a-kind center, catering to vaccines, biotherapeutics, from strain to supply. Every feature has been meticulously planned to build solutions that are compliant, competitive, cost-effective, and comprehensive. The lower level will have black utilities in addition to the kill tank, zero liquid discharge system, effluent treatment plant, and rainwater harvesting system. Level 0 has been designed to house a modernized warehouse. Level 1 will house a state-of-the-art sterile formulation and fill unit equipped with a combination line for both liquid and lyophilized vials, pre-filled syringes, and cartridges. Level 2 will be dedicated to the manufacture of GMP-based drug substances encompassing proteins, peptides, and polysaccharides, and will feature 2 suites, one equipped with a static USP line and the other being single-use. Each USP line will be connected to an independent DSP line dedicated to clean utilities. Level 3 will have a centralized, fully integrated quality control department. On Level 4, you'll find a bioinformatics lab, a training center, and essential scientific support departments, including quality assurance, regulatory affairs, intellectual property, legal, and more. The terrace will feature a cafeteria, recreational spaces, clean utilities, and solar panel installations. The facility and operations are being structured around low carbon footprint and climate change sustainability concepts, with various initiatives such as renewable energy, rainwater harvesting, and zero liquid discharge. We envision the concept of GCMC as a game changer towards pandemic preparedness and the accelerated development of medical countermeasures. The output will include tech packs that are IP secured, process optimized, scaled up, validated, and regulatory approved, backed by preclinical and clinical data. Ready for the transfer of technology to identified brownfield projects and greenfield projects supported by Team Tech Invention. At GCMC, we are striving to address all vulnerabilities of superheroes in biotech healthcare, thereby enabling capacity building and manufacturing infrastructure across LMICs. Let's collaborate to accelerate.
Thank you. Last minute, 1 minute. Faisal, if one thing you would like to see post-pandemic, what could be that for pandemic preparedness? One thing out of whatever things we have discussed today.
Many things. I think collaboration.
Collaboration, and advance is one of them.
Yeah.
Sushant.
I think I will agree. So having public-private partnership with a very specific focus on making the products available, not only vaccines as you talked about, but making all those products available to different countries. I think that's going to be the main thing.
Hani.
R&D innovation that is firmly anchored in the value of public health.
Dr.
Yeah.
Barazdir.
It's definitely collaboration with national and international authorities, and the strengthening of the capacity of regulatory authority also, and to make together within collaboration, get every country's in equitable access for vaccine therapeutics and diagnostics. Thank you.
Thank you. Sayed.
A more seamless interface and communication between the human health and the animal health ecosystems.
Well, thank you so much. The message is clear, and perhaps Advance, which we are going to launch today, is a right opportune moment which will showcase both collaboration, which will also work on R&Ds and also perhaps link human with animal health. Well, thank you so much, gentlemen, for this great interjections. So thankful to you. The panelists will stay back after a couple of other sessions so you can have interaction with them if you have questions or queries, since I am running out of time and do not have time for open-ended questions. But thank you so much.
Yes, thank you so much, Dinesh and the panelists, for the very fruitful discussion. We really wanted more time for this, for the Q&A, but we are running out of time. So we'll go over to the next session. So the next panel discussion will be on regulatory capacity building. So I would like to invite Dr. Ye Su, the Senior Health Specialist from ADB, as a moderator. And the panelists will be Professor John Lim from Center of Regulatory Excellence, Duke NUS Medical School, Mr. Roy Himawan from Pharmaceutical and Medical Device Resilience, Indonesia, and Ms. Diane Fontanille from Philippines FDA. So please have a seat. I'll hand over the microphone to Ye.
Thank you. Good afternoon, everyone. Good afternoon, ladies and gentlemen, and all the experts in the room. Thank you for joining us in this panel on regulatory capacity development. So, as Jay has already introduced this, today we have 3 experts from our member countries and also from academia to share with us their efforts in regulatory capacity development. We have been discussing how regulation and regulatory capacity has been a key link in the development and deployment of health technologies. Today, we will hear from country experience as well as academia capacity development efforts. I personally work in Indonesia, so I would like to take the liberty to invite my client, Mr. Roy Himawan, to first share about Indonesia's experience in regulatory capacity enhancement. Thank you.
Sure. Thank you very much, Dr. Ye, for the opportunity, and thank you for IDB for having me today. So I'd like to speak on behalf of the ministry, although it's not an expert one, but we are doing the daily work on this one together with our Indonesian NRA. I believe our colleague also attended today here to the presentation. So this is our view on responding to the need of regulatory capacity building. Well, on the previous panel, we talked about tech transfer importance, and now we are talking about the regulatory capacity importance on having the progress or on preparation for the pandemics. So on the next slide, you will see that as we hold the event on Korea, that hold the tradition on swords, I kindly encourage you to see the Hwando traditions in Korea, a practical and legend single-edged sword. So I would like to associate the capacity building on regulatory experience, regulatory capacity as a sword that we have to make it, that have to be fast, sharp, and wise. Because in pandemic times, when we come to pandemic, all the regulatory authority will feel very under pressed, because they are facing to the condition that they have to make faster decision, but with the limited data available to ensure the safety, quality, and efficacy. And not to mention that to make this more pressure, not only from their boss strengthening the pressure, but also from the public and non-health stakeholders, politicians, academics, all the people will talk to the NRAs, can you do your work faster? So then they will be under pressure for this condition. And while on previous session and on our opening sermon today, we often heard about fast when we talk about pandemic. So then there will be need to fast action in regulatory position to do the action in precisely. But however, we do see that based on WHO estimation, there's a different regulatory capacity across the globe. you may see only 26% of member states of WHO have functioning NRA. And of them, only 7 NRA from LMICs have achieved maturity level 3. So in the time that you're being pressed to be fast, but you don't have the capacity, so it makes the background that you need to uplift the capacity of regulatory authority. So by having this, we come to the conclusion that there is a need to do creative options of working together in the aspect of regulatory authority. So in the next slide, you will see that for this, can we go to the next slide? For this creative options that we propose on the next slide, please. So we have to swing the sword fast, sharp, and wise. So the creative options that may be able to collaborate, that we have identified that from the experts, several actions can be made, start from the preclinical aspect, goes to the clinical aspect, and goes to the enhancing manufacturing aspect that can be considered as an intervention to make it fast and sharp and also wise. And to do this, at least 5 actions that can be done, we propose that there is need to be collaborators, either it globally or regionally, to do the collaborative actions, including the regulators. So by having this, we do see by having more and more LMIC-based SRAs will empower local vaccine innovations and facilitate vaccine development with regionally appropriate frameworks that will lead us to more a prepared condition to have the pandemics. So I'll stop here. Thank you very much, Jay.
Thank you very much, Pak Roy. I have some questions regarding your presentation, but maybe I will come back to that later, given that we have limited time. May I hand over to Ms. Dane to share about the Philippines experience? Thank you very much.
Good afternoon, everyone. So I am Dane Fontanilla. I am a regulation officer of the Food and Drug Administration Philippines, specifically under the Vaccines and Biologicals Unit. COVID-19 pandemic actually served as an opportunity for us to improve and strengthen our regulatory systems, especially to ensure a rapid and timely evaluation and approval of vaccines, therapeutics, and diagnostics for future public health emergencies. So to answer the key question, I prepared a few slides. There are 3 key points. Next slide, please. One is the improvement of national legislation or the regulatory policies and guidelines. So the legal framework should be able to adaptive and flexible to sustain or to define the pathway to use for emergency or marketing authorizations for VTDs or the vaccines, therapeutics, and diagnostics to address the public health needs. For the Philippines, for the FDA Philippines, we implemented the emergency use authorization during the COVID-19, and the principles of regulatory reliance and recognition are adopted to accelerate the evaluation and approval process to ensure immediate access of these products. The FDA also recognized that instituting or adopting good reliance practices would be impactful toward facilitating the access of the VTDs, especially during the public health emergencies. The FDA Philippines also implemented the facilitated review pathway of the FRP through abridged and verification reviews to institutionalize regulatory reliance, as well as the collaborative registration procedure or the CRP with the of the World Health Organization pre-qualified vaccines and drug products. And I believe the 12th annual meeting with the WHO and ASEAN on the CRP will be held tomorrow in Jakarta, Indonesia, to be followed by WHO ASEAN meeting on joint assessment, which will be attended by our fellow delegates from the NMRAs all over the world. So next slide, please. The next key point is the networking and collaboration. This include harmonizing regulatory standards and practices with other drug regulatory agencies and organizations to help ensure VTDs are qualified and to reduce barriers to access. And the networking and a good example of a networking and collaboration of the FDA Philippines is the ASEAN Consultative Committee on Standards and Quality Pharmaceutical Product Working Group, or what we call ACCSQ PPWG. And one of the agenda of the PPWG meeting is the ASEAN Joint Assessment Procedure through Joint Assessment Coordinating Group, which was developed by the national regulatory authorities of the ASEAN member states to facilitate the marketing authorization, as well as to encourage regional collaboration and work sharing among the NRAs. And at the end of the process, the participating NRAs will come up with their individual decision making based on the joint assessment reports, as well as relevant considerations on the national level. Next slide, please. And the last key point is the capacity building activities. It is very essential or important to enhance the competencies and capabilities of our regulators. You have to be equipped to assess the applications, especially for those more complex products, such as vaccines and biologicals, which are most likely be needed during the public health emergencies or pandemics. And for the FDA Philippines, we have internal capacity building activities, such as the retooling of our processes, eco seminars of local and international trainings that we attended, as well as the cascading of working procedures. And we also have from our external experts, external stakeholders, for the training of trainers, most of our external stakeholders, such as WHO, IVI as well, and Gavi, ADB as well, and APEC ASEAN, who gave trainings for us for capacity building of our personnel. So next slide, please. Ayun. Salamat po. Thank you.
Thank you very much, Ms. Day, for sharing your experience. As a follow-up to your presentations, I hear a lot about the faster actions required by regulatory agencies. I hear that there is a lot of need for creative collaborations and, of course, capacity development. I would like to follow up with questions about what capacities do you see most important for national regulatory authorities to enhance post-pandemic. But before that, I think your presentation provides a good segue for Professor John Lim to share some of the collaborations between us and his institution in regulatory capacity enhancement. Professor John Lim.
Thank you very much. Could I have my slides up, please? So, thank you very much to ADB, not only just for inviting me here, but for the ongoing possibilities to engage with you, to support the region. My center now is 10 years old. We just celebrated our 10th anniversary. And as you can see from this slide, we are building on a networking collaboration platform and building up to the 2 orange bars on top to strengthen health products regulation in Asia and the Pacific. And also now we're looking at health systems and services regulation as well, building on education, which is specific to this session, and capacity building. But to do this, we also need to provide advice and, of course, to be a think tank as well. In fact, this dream really was when I used to be CEO of the Singapore Health Sciences Authority. We wanted to be an academy to build up the capacity of regulators, and I've been very privileged for the last decade to be able to do this. And of course, this has been specifically also with the ADB in 2 key projects. One from 2017, actually it was 2015 to 2017, when we were looking at the Greater Mekong sub-region to strengthen the regulatory systems in the 5 ASEAN countries of the GMS at the time, looking at malaria interventions, but we covered health products, medical devices regulation. And you can see some of the countries we covered in those years in Lao PDR, Cambodia, Vietnam. But more recently, for the current project that is still ongoing, where we're looking at strengthening the vaccine manufacturing capacities and the regulatory capabilities to do this. So slightly over a year ago, in fact, many people in this room were at our school in Singapore for a vaccine seminar to look at the amalgamation of science, policy, and practice for fit-for-purpose vaccine technologies. And from this, we have produced various reports. And in fact, one of the follow-throughs is to support Badan POM in Indonesia. And currently, some of my colleagues are now in Jakarta, actually today, conducting training on advanced therapies in support of strengthening Badan POM to become a WHO-listed authority and also to become maturity level 4. So these are very important capacity building projects. These are 4 of the policy briefs that are coming out soon from the seminar last year. And you can see we are looking at sustainable, locally relevant vaccine R&D in lower resource settings. We're looking at manufacturing and other considerations of vaccine technologies also in low resource settings. Specific, I think, to today is the fit-for-purpose, confidence-based regulation across the vaccine life cycle. And of course, this is to support advance as well as a path for Asia and the Pacific to enhance pandemic preparedness. And fourthly, to build sustainable vaccine manufacturing practices in low resource settings. The key recommendations from the regional landscape analysis that is part of this project, not just of the seminar last year, is to look at these 5 countries, Bangladesh, Indonesia, India, Korea, and Singapore. So we're looking at ML4 countries in relation to ML3, or those aspiring to be ML3. And I think what is important for today for us to consider is that the findings suggest that a whole of region approach is very important. It has already been hinted at in the previous session and actually quite explicitly stated by Dr. Eduardo and Dr. Dinesh. But I think we can potentially enhance the coordination of the resource support to strengthen regulatory systems, particularly for the DMCs of the ADB. And we can certainly better leverage and build on existing international and sub-regional regulatory platforms to facilitate the application of more common and aligned regulatory standards to strengthen regulatory cooperation. So I think this is a critical step forward. And in fact, we would like to propose that advance, of course, I think really is part of this, but we do need this regional level regulatory network or alliance in Asia and the Pacific because we want to promote confidence-based regulation. And we also want to promulgate regulatory international best practices. So I think that is really the summary of our work with the ADB so far, and we look forward to working with all of you in the room. And of course, we look forward to advancing. Thank you.
Thank you very much, Professor Zhang Lim. And we really appreciate our collaboration with CORE since 2017. So a question for our panels. Particularly from the country's perspective, what do you think that are the critical capacities that your government would like to invest more in enhancing to help your national regulatory authority to reach a higher maturity level?
So thank you, Dr. Ye. And to do this, we believe Indonesia will take a benefit more by having our regulatory capacity being improved, such like the course now being conducted by Dr. Lim in Jakarta. Now we are learning the ITMP's regulation and how to make it more available to Indonesian population. But we do see that the other method that we can we can call like a creative options to work as a regulator is also available to be explored. So we are very welcome if there is any initiative that work on this one. So then will have better capacity to regulate our pharmaceutical and medical device. Because when we talk about pandemic preparedness, it's not only vaccines, but including diagnostics and therapeutics. So by having that sense, we are looking forward for any creative options that may be put further, just like globally coordinated worm-based for large agile trials that will able to make our regulatory be more informed and more daily habited with how to support the global large and agile trials. It's also include on how the capability on review and manufacturing oversight. It's also be a good one to be to prioritize and to explore on collaborative inspections and global information sharing. It's also important for the regulators to do on that. Thank you.
Thank you. Ms. Dane?
For the FDA Philippines, I think our priority is the improvement of our national legislations. Currently, we are still revising, or is still on the process of revising current policies and regulations for the pharmaceutical use and API as well. We also are currently released the rules and regulations for the registration of pharmaceutical product and API for human use, and pharmaceutical product and API intended solely for export. Although we still don't implement those policies, since we still have to publish it to the public, but with the leadership of our Director General, we still have a long way to go. And yeah, that's our main priority right now.
Thank you very much. Legislation is the first step. And Professor Chong Lim?
I think there are two levels we need to look at. One is at the national level, and my colleagues here have already talked about the specific situations in Philippines and Indonesia. Even in Singapore, where we've already reached maturity level 4 and we're a WHO-listed authority, I think there has to be continual upgrading of regulatory skills and capacity, because the challenges never end. So within the national frameworks, we have to continue building on that. So I think academic institutions like my own center, working closely with the National Regulatory Authority, are very important to do this. But also, the other thing that needs to be done is to stop looking purely at health products regulation in a silo of its own. And I think with vaccines, and especially things like advanced therapies, and there was another session this morning looking at AI in terms of products and health services, we need to look at how health products regulation, health services regulation begins to come together more. And this is, I think, something very important for us to consider, even as we're looking at things like One Health and animal health. So we're not just looking at NRAs as we have known them in the past, but we need to be positioned for the future. And I think to do this, we have to work across the region. So what ADB is doing is very critical. And I think ministries of health cannot function in isolation from other players within government, either within national jurisdictions or across the region. So I think that's very important for the future.
Thank you very much. I take that point, and I hope Jay can include in his TA activities that of fostering regional collaboration, and also the collaboration between the drug regulators and the health service regulators. Okay, so I guess my next question is for regional collaboration. Do you see the current mechanism that you're in as effective? I think a few examples were mentioned. The ASEAN have this regulators network, and advance hope to also establish and advance this regional collaboration. What advice would you give to us in implementing this regional network?
Okay, thank you, Dr. Ye, for the questions. And this is quite interesting to see that in regional level, we came with a different capacity of regulatory oversight. So by having the fact that every country has different capability, it's important to understand what is the critical point that to be elaborated in every country with the same technical one. Because if we come to every country needed, so you will go to the very different options of improving the capacity. But when we come to if we can come to a single most prioritized technical level that need to be empowered across the countries, so we can go to something that is more feasible to all countries to implement it. So I mean, just like that example, the regulation on labeling. Regulation on labeling is because we see from the WHO assessment, also from the industries, they're seeking that many countries now imposing a very different regulation on label. Many countries mandate or obligate the industry to put a local language on the package, and many others also mandate the time of release of the package to go to the primary package of a product. So imagine if a region where there is 10 countries have a different requirement on label, what will happen for an industry who want to come and who produce and who to bring the access of product to that region, he or she will have to make 10 different product. But even though it is the same product itself. So by having this understanding, we do see that if we can come to a single technical detail that very most important for all countries to implement, it is something that very valuable to work on. Dr. Ye. Thank you.
Thank you.
I think the harmonizing the regulatory standards and practices in the regional level is very important as well. As I've said earlier, the joint assessment with the ASEAN NRAs is a big help to us as well. As a vaccine importing country, we really need good reliance practice with the ASEAN, with other external stakeholders. So with the continuous PPWG meeting as well is a big help to the improvement of our regulatory system. Thank you.
I would just like to add to that because I think Valerio and I have been involved with ASEAN PPWG since 20 years ago, from the early 2000s. So it's not that harmonization has not been advanced or highlighted as a priority. And in fact, we do have the common technical dossier and requirements that have been around for many years. I think joint assessment has moved it further forward. But what really is important, I think, is that the region must be strongly committed to make this happen. And I think the pandemic challenged this because even though the harmonization efforts were there, exactly what we've heard, it was not possible to have a common ASEAN position on vaccine approvals and dissemination. So I think it actually goes beyond just the regulatory authorities. And what ADB is doing is very critical to bring the other players into the room, because national regulatory authorities, ministries of health in themselves may be well-intentioned, but the ability to effect the things that we're talking about actually goes beyond that. It's engaging the ministries of finance, involving the political leadership. And I think this is what is going to make that significant difference in making harmonization and convergence actually work to achieve what we're talking about today in terms of equity of vaccine development, manufacturing, and availability.
Great, thank you so much. With that, we have quickly used up our time. So thanks again to all the panelists for your discussion today. Thank you.
Yes, thank you very much, Ye, and thank you very much for the panelists. So first we talked about the manufacturing and R&D, and then we talked about the regulatory capacity building and about the situation of the countries. So now we will be talking about regulatory harmonization and convergence, and I would like to invite the panelists upon the stage. It's Dr. Jin-Ho Shin from WHO Western Pacific Region Office, Dr. In-Suk Park from Korea Regulatory Science Center, and Dr. Valerio Reggi, Regulatory System Strengthening in Asian Development Bank. And for this session, I'll be a moderator. I'm Jae Kyun Kim, Health Specialist at the Asian Development Bank. So please have a seat. Thank you. So for our session, we have asked the panelists a single question. So the question is, why are regulatory harmonization and convergence essential for preparing for future pandemics to ensure access to vaccine therapeutic diagnostics, and what key steps are needed? The reason we had one question for all the panelists here is that you could recognize that we have, from different perspectives, we have Dr. Shin from WHO, we have Dr. In-Suk Park from the Regulatory Science Center, but also former from Korea Ministry of Food and Drug Safety. And we have Valerio to give perspectives on the Asian Development Bank. So first, I will hand over the microphone to Dr. Shin. Thank you.
First of all, thank you very much for invitation, so particularly the ADB for this session. And I prepared a few slides because this regulatory harmonization convergence actually a really long history, and already it's probably it's part of also regulatory capacity building. The previous panel members discussed and alluded the importance of the harmonization convergence. So just because we talk about many times the convergence and harmonization, but I'd like to give just a little bit of flavor because there's some nuance and understanding difference. So first of all, I brought this the definition from the WHO, the guidelines. They recently published the good regulatory practice. Particularly this convergence is more on, it looks like because it's already divergent regulation. So wanted to go, one probably the one target, something like that. So the different countries, regions, becoming more similar and aligned, over time. So this actually, the scope covers the various, the guidelines and the standard scientific principles. So there, final a decision making will be always with the national regulatory authority. There is a flexibility in decision making. So some of the part of the process actually involved is a mutual recognition agreement among regulatory authorities, and also the particular interest, like a regional integration, in continent with EU, and also recently a lot of developments happening in African continent, and particularly WHO facilitate joint review and the collaborative registration procedures. Because WHO invite the interested manufacturers provide dossier kind of explanation, and then the global experts and interested national regulatory authority, the professions, they attend and participate those registration, the evaluation, and then the decision will be taken by the national regulatory authority. And so this kind of process actually help reduce the regulatory work by avoiding duplication. So particularly the harmonization is more on the technical standard level. So the best example, I would say, we know much about ICH standards, the quality, safety, and efficacy, and the common technical documents. Those are equally, those members equally adopt into their national regulation. So there is no flexibility in using those standards. And also WHO has been involved in this process, not the stringent as ICH, but also WHO provides reference standards
which is unique, and countries use these international reference standards and develop national standards. So this is one standard, single standard guides clinical dosing of those, for instance, insulin. All those, the biological vaccines defined by international unit actually is from WHO, the collaborative studies. And WHO also developed lots of written standards, but the WHO recommends those countries to adopt fully or partially, depending on the country context and their own legislation systems. And so added value is actually the simplified product development and regulatory approval, because it's a single standard. The developers use only one single standard as a guide. So particularly the one summary is regarding uniformity or not. So this is maybe this make distinction. So rest of the slides, actually I already mentioned some of the key international organization institutions involved in this regulatory convergence harmonization already long history. So I would probably skip, and also there is regional networks working on this mostly regulatory harmonization on convergence. It's a long history. Actually came from Pan American Health Organization, and recently also the Western Pacific region. The support from the member states, national regulatory authorities, they create this the regional alliance to discuss mostly about benchmarking and the emergency preparedness and so on. So also it's important to understand what other sectors, institutions also doing this same or similar thing before launching this very important advanced kind of network, the ADB, the proposing today is this. Particularly we are part of also the number of countries part of the APEC trade economic bloc, and also ASEAN the bloc. So there are a lot of the initiatives already ongoing in these two trade and economic bloc. So I think this is going to be next step. What are they really doing it, and we really need to understand what actually with them together. What specific this advanced network can do. And so particularly the question, the first question, why part, just reiterate, accelerating approval process through this convergence harmonization. I think this is really one, I think, added benefit. And also using the same standard, manufacturing, the practice, using the same standard, make sure the consistency of the product, so that gaining public trust. And because of the sharing resources, the potential saving cost, and also enhancing coordination among regulators and the global, regional, and country level. And particularly, most importantly, addressing those health equity issues through this the process. I think this is more or less ending. Particularly this process actually also not covering whole aspect of access dimension, but mainly the availability, acceptability, probably, but not affordability, accessibility, those logistic issues. But they can be covered other topics. Thank you very much.
Oh, yes, thank you very much, Dr. Shin, for that presentation and for the rich information. We really acknowledge that WHO's work on the NRA Alliance, both in the Western Pacific region and the Southeast Asia region. And we really think that in the advanced network, we need a strong partnership on that part. Thank you very much. And now I would like to introduce Dr. Park for the same question, please.
Yes, nice to meet you. I'm happy to join this panel discussion. Okay. Where is no? Okay. Yeah. I'd like to talk about the importance and necessity of regulatory harmonization in case of the COVID-19 pandemic and vaccines, and what global activities the Korea regulatory body MFDS is carrying out. Several recent studies have reported that unsatisfactory medical demand is increasing, and to resolve this, R&D investment must be increased, and global regulatory harmonization is needed along with increasing market demand. During this pandemic, we have learned the importance of vaccine and the development of innovative vaccines, which not only protect people from infectious disease, but in some cases can even reduce the gap in the severity of the disease. This slide is an excerpt from a research paper on the need for regulatory harmonization in the clinical trial field to promote the development of life-saving vaccines. It typically takes about 10 to 15 years to develop a new vaccine and establish its quality, immunogenicity, safety, efficacy, and durability. Many countries required local, typically safety and immunogenicity data for regulatory approval purposes. This delays regulatory approval and ultimately makes it difficult to conduct clinical studies in a timely manner. The picture on the left side is an analysis of the time it takes to get approval for a clinical trial application from 1999 to 2018. The red graph shows the approval schedule for 931 clinical trials conducted in ICH member countries and compared with data from 23 countries around the world. In a pandemic, timelines may be much shorter, and the temporary legislation may be enacted to streamline in process. In Korea also, a special act on the public health crisis response was enacted in this coronavirus pandemic situation, so that treatments and vaccines could be approved quickly. However, this practice may not apply outside of a pandemic, I think. Therefore, in order for drugs to be approved quickly, even in normal times, not only researchers, but also regulatory authorities need to think about how to achieve regulatory harmonization. Ultimately, regulatory harmonization improves the long life cycle from drug development to use, allowing new products to be applied quickly to patients and also reducing unnecessary expenses in terms of social costs. I think we can find ways to harmonize the regulations through various information exchange, discussions, and mutual cooperation project. This is a recent example of Korea's ongoing efforts toward international harmony. We joined PICS in 2014 and ICH as a full member in 2016. We supported the rapid supply and development of medicines with our global activities. Through this, we have continued to pursue efforts to converge regulations at governmental level for faster and better patient access. Recently, GBT, which was evaluated by WHO for its regulatory agency capabilities, was evaluated as achieving the highest level for regulation of competency called ML4 for both medicines and vaccines. And in the end of in 2023, the MFDS became the first country in the world to be registered in the WLL, along with Singapore and Switzerland. Since the coronavirus pandemic, Korea has been collaborating with other countries and international organizations to support domestic products entering the global market and contributed to the international community. We participated in IPRP and served as chair of the biosimilar working group. And in 2018, we participated in the WHO biosimilar PQ working group expert meeting. I believe that these activities and collaboration level have laid the foundation for the success of K Pharmaceuticals. Not only regulatory agencies, but also the Korean Pharmaceutical Industry Association, such as KRPIA, KOBIA, and KPBMA, are continuing efforts through various methods to move toward a higher level of healthcare ecosystem through implementation of international harmonization. Korea is working closely with regulatory agency and industry and academia in the drug development process. I hope in near future, our center, Korea Regulatory Center, will also play a role in some strengthening regulatory capabilities. I hope that Korea's good examples for international cooperation and support for the pharmaceutical industry will be helpful in establishing each country's pharmaceutical regulatory system. That's all. Thank you.
Yes, thank you very much, Dr. Park, especially for sharing the examples of Korea Ministry of Food and Drug Safety on this regulatory harmonization and convergence work. And as you mentioned, it's not just the NRAs, it's also the private manufacturers, academia, research institutions that we have to partner together. And all people here, and also especially the countries with high maturity level for the NRAs, like Australia, Korea, Singapore, Japan. I think there's a certain critical portion of role to do. So lastly, I will hand off the microphone to Dr. Valerio.
Thank you. Good afternoon. I have been given 3 to 5 minutes to try and answer the same question as everybody else. The question is why harmonization and regulatory conversion is essential. Now, I propose, well, we need to simplify to respond in a few minutes. So I propose to look at 2 aspects. One is that new medical products are more and more complicated to assess. And this requires skills that are not found everywhere. The other aspect is what has already been mentioned, is that the majority of WHO member states have weak regulatory systems. And for many, if not most, of these countries, the solution cannot come from additional investment. It will not improve the situation by adding more resources and more stuff. It's impossible that all the countries of the world will become able to do everything in the best possible way. So this leads to the need for harmonization of requirements, convergence of regulatory practices. These 2 things would permit better communication among the regulatory authorities and would also enable reliance on the work done by better performing authorities. cooperation and reliance are concepts that have been endorsed by every man on earth and every woman as well. And, but these are mostly implemented by the best resource authorities among themselves. Why is this not happening in least and less and middle income countries? Substantially because they cannot do it by themselves, and there is nobody who is doing it. Nobody is creating a mechanism, a platform, a system, a network, a something that is real, that can be used, and will be able to let participating countries to share information, to rely on each other, to listen to each other, to learn from each other, and to improve mutual trust and capacity to work together. The ADB members, regional members, include 4 of the world's best resourced authorities. You will easily detect what I'm suggesting from this graph. The idea behind an initiative like ADVANCE is to be able to create an actual operational mechanism for the exchange of information so that LMCs will be able to benefit from the outcome of the work done by better performing authorities in the region. I have to declare that I have no conflicts of interest, but I'm looking at one part of this room as a, I mean, the thing is that who is going to do it? ADB alone cannot do that thing. And a national regulatory authority alone cannot do that thing. It needs to be something that is created by putting together the experience of regulators, the experience of academic institutions, and looking at the competence and the agility of the capacity to operate is not strange to my mind. Well, if ADB were able to join forces with casually an institution in a small island somewhere southeast of Asia. It's one of the options that comes to my mind after the discussion we have had this afternoon. I hope that I've done it in 3 minutes. Thank you.
Thank you very much, Dr. Valerio. Especially the part kind of struck on why it's not done in the LMICs. So it's quite definite that it is really helpful for the LMIC countries, but also we have to find a sweet spot that it should be beneficial to the high-income countries as well. So that could be a further discussion on how we can find that modality. And thank you for emphasizing the importance of partnership. ADB, we can't do it ourselves, and the single NRA can't do it. But we saw a lot of stories and heard stories from the countries, like they're very innovative therapeutics, diagnostics, but because it wasn't approved, they can't use it. It's based on the capacity. It could be like a political, but this kind of an initiative could really help that kind of situation. So please give a big hand to the panelists again. Thank you so much. And now we'll be moving to the last panel discussion on pool procurement for vaccine therapeutics and diagnostics. So I would like to invite Dr. Benjamin Coughlin from the Asian Development Bank and the panelist, Mr. Luigi Bonafati from RVMC, Mr. Philip Kalpaxis, procurement specialist from ADB, and Professor Udeni from Monash University. And unfortunately, Ms. Hui Yang from Global Fund and Christopher Lim from PAHO couldn't join us in person, but they will be participating as a pre-recording video. So over to you, Ben.
Thanks very much, Jay. And thanks everyone for your patience. I see the room still mostly packed, and we're right at the end of the day. So we've heard about regulation, we've heard about manufacturing, and I think we need to explore another lever, perhaps, for making medical countermeasures affordable, supply chains reliable, and to bring innovation into supply chains, things like climate change that Dinesh started off, biosafety, which has come out through conversations here. And one measure we haven't really tapped is pool procurement options. They've sort of been at the fringe of things, but it's not an area where ADB has really played in. So we brought together 5 experts today to talk about that. Now, before we get into discussing how pool procurement could work feasibly in Asia Pacific, we asked Udeni from Monash University the question, a what-if question. What would have happened or could have happened within Asia Pacific if we had a pool procurement for COVID vaccines? So we're starting out with that question perhaps to give us a little impetus to do more on pool procurement. So Udeni, please.
Thank you, Ben, and thank you everyone for the invitation to speak as part of the panel. So just to start off things, I'm not a professor, just a research fellow at the Center for Health Economics at Monash University. We are a 30-year-old research center working a lot in the area of health financing, health regulation, HTA, health technology assessments within Australia as well as broadly in the Asia Pacific. So in this project, we kind of did a what-if analysis. So we set out wanting to look at how the Asia Pacific countries fared in terms of procuring COVID-19 vaccines between the 2021-2023 period, and also as part of it, looked at what the situation could have been had there been a pool procurement mechanism operational within the region. So, right, so before I share some extremely preliminary results with you, there's a few caveats that need to be set up in terms of how this analysis took place. One of the biggest stumbling blocks that researchers face in doing this kind of analysis is the limited transparency when it comes to pricing. Particularly an issue around COVID-19 vaccines, there's a lot of NDAs. So pretty much authentic pricing information is very hard to come by. Yet, so our approach was to bring together a number of different validated sources, cross-validate the different numbers that have been indicated in terms of volumes, as well as the prices for different kinds of vaccines, and then pull together the analysis from the pooled data. So we very much rely on the weighted average pricing whenever that's reported in these official sources. And what we essentially did was we looked at a pool procurement system that was in place during COVID. There are a number of different examples, but we went with the PAHO system as an exemplar, and really looked at trying to map countries in the Asia Pacific region with similar countries in the PAHO bloc to see how they fared with regards to different vaccines. So the examples that I have up there are very preliminary examples calculated for one particular type of vaccine, which is the Pfizer-BioNTech. And we kind of match countries based on their GDP per capita and population. And there's never a perfect match. We are never going to find a country with both those metrics. So we go by at least one of the metrics, right? So the first case that we have here is where we looked at Bangladesh and compared it to Bolivia. Now, Bolivia is a relatively small country in the PAHO region, but in terms of per capita GDP, the two countries are quite similar. And working with the weighted average prices for the Pfizer vaccine, we see on your left-hand side the prices, or the average weighted price paid for the vaccine over the 3 years by Bangladesh has been consistently higher than what was paid by Bolivia as part of PAHO. Now, this may or may not be true. Again, we're working with weighted average prices here. But what does that translate to in terms of volume, which is what is the important question. And you see on your right-hand side, just in terms of 2022, the peak of the pandemic, this pricing differential in what Bangladesh and Bolivia has paid would have accounted for an additional 87 million doses approximately of that particular type of vaccine to be purchased by Bangladesh. And over the 3 years, a cumulative savings of a substantial amount as well due to the price differential. So that was one example we worked with. The other one is for two smaller countries in both the regions, Tajikistan versus Honduras. They're similar by and large in population, but again, in terms of GDP per cap, Honduras is in a much higher position than Tajikistan. And again, when we do a similar comparison on the right-hand side, you see, due to the price differential, just with regards to what was paid for the Pfizer vaccine, that would have accounted for an additional 1.8 million doses at the peak of the pandemic. So this is just very preliminary results here. We're continuing with this project, but by and large, it kind of highlights the importance, I guess, of having a pooled procurement mechanism, at least with regards to the pandemic.
Thanks very much, Adani. I think we heard in the first session costs, were the lever for Bangladesh, right, to transition out of Gavi. So what are they going to do to change their manufacturing and regulatory systems? And so maybe this in terms of, emergency responses, pooled procurement for emergency supplies of medical countermeasures, the finances perhaps are pointing us to much more collaborative measures for purchasing our essential medical products. So in that vein, I think we're going to look at two pre-recorded messages from arguably two of the best and most well-established pooled procurement mechanisms, one at the global level from Global Fund and one at the regional level in the Pan American Health Organization. So we'll go first to Hui Yang from the Head of Supply Operations at Global Fund.
Good afternoon. My name is Hui Yang, the Head of Supply Operations at the Global Fund. First, I want to thank Asia Development Bank and partners to call this initiative to life. I'm delighted to share our perspective on how pooled procurement mechanisms can improve access to health products such as diagnostics and therapeutics, especially in the face of future health crises such as pandemics. In pursuit of Global Fund's mission to defeat HIV, tuberculosis, and malaria, ensure a healthier, safer, and more equitable future for all, we raise and invest more than $5 billion a year to fight these diseases and strengthen health system and pandemic preparedness in more than 100 countries. Since 2002, our partnership has saved 65 million lives, but there is more work to be done in the face of great challenges such as climate impact, geopolitical crisis, and others. Global Fund strategy aims to support integrated systems for health to deliver impact, resilience, and sustainability, and contribute to pandemic preparedness and response. Remain agile to respond directly to the rapidly evolving global health context. Every year, the Global Fund invests more than $2 billion in health product procurement, and majority is transacted through our pooled procurement mechanism and OneBoard.org procurement platform, one of the largest global platforms in the public sector to date. Building on lessons learned from the COVID-19 pandemic, we have developed next-gen market-shaping approaches to drive equitable access to quality-assured health products for the people and communities the Global Fund serves. Our market-shaping efforts leverage our country-led model and inclusive partnerships with countries, civil society organizations, global and regional partners, and private sector. An important component of our next-gen market-shaping efforts includes supporting regional collaborations for procurement. Why are we doing this? We consider this critical for improving the availability and affordability of quality assured health products for more equitable access to meet the needs of people and communities. A well-developed and functioning regional procurement platform will contribute to a more resilient supply chains that can continue to provide crucial health products despite global disruptions and accelerate the introduction of new products when needed. Effective collaboration and coordination will enable greater impact to collective buying power and support market sustainability. What specifically we are doing? We are actively engaging with the global and regional actors to enhance the procurement platforms and consortiums. We focus on knowledge transfer and capacity building at national and regional level. This includes improved availability of market information and increased regional harmonization and regulatory pathways. In addition, we are incentivizing suppliers to meet harmonized quality assurance standards by leveraging global fund tenders. Finally, we are enhancing our approach to collaborative procurement through an updated procurement policy. Along with this, we are continuing to leverage the global pool procurement One Board platform as an enabler for strengthening the capacity of regional and national procurement channels to support sustainability and access to health products. Complementarity is an important feature of our efforts. While PPM focus on HIV, TB, malaria products, we recognize that commodities for neglected tropical diseases and antimicrobial resistance are better managed regionally. Openness to sharing information will be equally critical. This includes providing access to our long-term agreement and joint tender approaches, as we have done so with PAHO in the Americas for many years. It is important to highlight that the Global Fund promotes a value-driven procurement approach. Factors considered in our procurement decision include beyond just pricing, such as quality, transparency, use of long-term agreements, total cost of ownership, sustainability of supply, and risk management. It would take collective determination, sustainable investment, and country commitment to build a well-developed, well-managed national procurement mechanisms. As we progress on this work, we are very keen to collaborate with ADB as they evolve their plans for regional pool procurement mechanism in Asia region, and I look forward to the outcomes of the productive discussions that will emerge from this meeting and to our continued collaboration. Thank you.
Thanks very much, Wei Yang. I think there's a lot in there that we need to really dissect, and Philip and Luigi are going to help us do that. We're going to turn now perhaps to the gold standard in terms of pool procurement, I guess the longest standing, which is PAHO. So we're going to hear now from Christopher Lim, who's the chief of their strategic fund for public health medicines.
Hi everyone, and a very good afternoon to everybody. My name is Christopher Lim. I'm the chief of the PAHO Strategic Fund, and it is a pleasure to be able to join all of you today, although not in person due to some personal reasons, but at least virtually to be able to discuss about this very important topic, which is also close to our mission at PAHO, Pan American Health Organization, which is the power of pool procurement to advance equitable access to life-saving vaccines, therapeutics, and diagnostics. With a collective experience of over 6 decades, PAHO's revolving funds for vaccines and strategic fund for public health supplies have provided essential health technologies to 42 countries across the Americas. And through the funds, we have consolidated regional demand and offering countries to access quality assured health technologies at affordable prices. But I also like to highlight that pool procurement is just but the culmination of a lot of precursors and foundational work before that. The funds represents a model of technical cooperation with many departments within PAHO to build capacity within countries to manage technical cooperations, related to regulatory, clinical, and supply chain management, which helps to facilitate efficient access to vaccines and medicines. Now, with this support, we ensure that all these technologies procured through the funds meet strict international WHO and PAHO quality standards. The trust and collaboration we've built over with our member states and partners are foundational to this success. And if you were to ask me, the single most critical success factor I would attribute is solidarity and shared visions and objectives among member states, along with robust technical cooperation, are key factors in achieving health security and supply resilience. Now, the other just as important element that I will attribute to is the regulatory harmonization and reliance across NRAs or national regulatory authorities of participating countries. Now, one of the ongoing examples that we have is on the development of regional manufacturing for vaccines. Now, we are currently working to harmonize regulations and establish reliance framework that empower countries to rapidly approve and produce quality assured vaccines that is accessible to all member states in our region. And these actions create not only self-sustaining regional supply chain, but also at the same time reduce our dependency on external sources and enhance our ability to respond swiftly to emerging health threats. Now, this is indeed a very timely opportunity whereby all regions, including Asia, can help to adapt to these strategies to ensure equitable access to health supply. Poor procurement combined with regulatory harmonization, technical cooperation, and also at the same time collaborative partnerships can help to create a system that is prepared, resilient, and also able to meet the demands of the next pandemic. Now let us seize this moment to strengthen our systems, build trust, and solidify partnerships that can transform access to health technologies across Asia in an equitable way and leave no one behind. Now, we are more than happy to share and exchange experiences to learn collectively. Now, I'm wishing all of you great success in this noble and important endeavor, and all the very best, and thank you.
Thanks very much, Chris. So we've heard the word regional a lot, and we've got someone who has regional on his business card. Luigi, you're from the Regionalised Vaccine, what is it, the last one? Manufacturing Collaborative. And you're the chief advisor to the CEO. So I'm just wondering, Chris talked about, a regional approach to supply and procurement from within PAHO. How do you see this evolving in Asia Pacific? And how do you see us sort of balancing the needs for routine delivery of medicines, essential medicines, but also that surge capacity to supply when we have an emergency?
Thanks, Ben, for the question and allowing me to express RVMC's position. As you said, RVMC has regionalized in it, which doesn't mean regional, but it's the way to bring closer to regions and markets pool procurement. And by doing that, first, there is the approach of pooling demand, which means giving a more sustainable approach to demand. If you look at a country level, demand could be up and down 1 year to another. Shelf life would mean you buy 1 year, you don't buy the next one. So for manufacturing and sustainability of manufacturers, it's very difficult. If you pool the demand, then you have something that is more stable, that is more linear. So behind that, you have more sustainability. Pool demand on the other side and pool procurement goes for volume, which is good. If you're a manufacturer, you want to produce and fill your capacity. But building on capacity on demand and having larger volumes means also that the largest manufacturers will have the lowest prices, which means that the name of the game is not equitable again, because the established manufacturer with the largest capacities will probably be able to bid for the lowest price. So you don't rebalance the equation and you don't regionalize procurement if you bid only on price. Now you need to find criteria that allow to rebalance, something that is more equitable. And I think the example of PAO is very good. They announced officially at DCVMN a few weeks ago that for their next procurement exercise, they will change the markup they have for vaccines that are procured within the region. Now, PAO has an experience of pool procurement of many, many years. But if we're looking at Latin America, vaccines were primarily coming from other regions into Latin America, and they were not favoring local manufacturers. I think this is a very good example that the other regions could try to mimic or to utilize, to think about, is to say, should there be criteria that allow local manufacturers to get an edge? Why? Well, it's very simple. If you have one manufacturer supplying 1 million or two manufacturers supplying each 500,000, those two manufacturers will sell it at a cost of goods which is slightly higher than the one that sells 1 million. You need to adjust for that if you really wish to get a regionalized approach which will go to sustainability, but also a more self-reliable approach to that. So I believe, yes, there is a way to incentivize pool procurement.
Thank you, Luigi. We're going to turn now to Philip, the last hurrah, really, to take us home. So, Philip, you're our resident pool procurement expert. In fact, you just released a publication for the Supply Chain Funders Forum, looking forward to models of pool procurement that are fit for purpose over the next 20, 30 years. So, given what Luigi said, what Chris and Hui Yang have said, how is ADB thinking about this, either at a regional level or through our 5 sub-regions, in terms of pool procurement to optimise equitable, sustainable supplies?
Yeah, thanks, Ben. Am I audible? Yes. So yeah, as Luigi mentioned, and many of the previous speakers, right, the recent health crisis have really underscored the need for greater regional cooperation, right? And so I just want to maybe, and I have one slide maybe as a backdrop, to highlight one emerging collaborative procurement initiative that ADB is supporting in Central Asia under the CAREC, or the Central Asia Regional Economic Cooperation Program, which is a partnership of 11 countries that for the last over 20 years, with ADB as its secretariat, has been promoting regional integration and regional cooperation, primarily in areas such as transport and energy and trade. But now, of course, with the COVID-19 pandemic, health has moved to the focus of the partnership as well. And so ADB has been now supporting through technical assistance the CAREC partnership, among other things, to explore how pooled procurement or collaborative procurement could help countries in securing sustained access to critical health supplies, and also address some of the long-standing issues that we see in the markets in the region, because the map is not there, but you would see that although it is a very diverse group of countries, both in terms of population size and market maturity and their health spending and the health system infrastructure, most of the CAREC countries actually face similar issues when it comes to the availability and the affordability and the quality of certain health products, both for emergency response as well as to meet their routine needs and to achieve UHC. And these issues are actually not unique or exclusive to CAREC. And they're not unique or exclusive to low and middle income countries. We see that many high income countries around the world are equally struggling frequently to access certain health products on their own. And they come to realize the limitations of some of the national solutions. And so we've seen in the last years, and I'd say probably in the last decade, a number of cross-country collaborative procurement arrangements emerging, especially in areas that are not covered by established mechanisms like PAHO, or for products that are not covered like by donor-supported procurement systems like the Global Fund. We've seen a lot in the European region, both at the EU level as well as at the sub-regional level, and increasingly also in other regions, in the Eastern Mediterranean region, in Africa. Just last month, the African Union announced the African Pooled Procurement Mechanism to be led by Africa CDC. So a lot of momentum there, less so in Asia, I will say. But in general, there is a trend that we can consider kind of a global trend of understanding the power of collective action in this space. And there is also growing empirical evidence, and I think Luigi mentioned a few of the potential benefits, that there is potential benefits in pooling procurement, right? There is, from a country's perspective, there is a benefit in potentially shifting the negotiating power towards country buyers. There is, I think, both for buyers and suppliers, it reduces transaction costs in the system as a whole. It allows to build in certain additional activities, such as financing options or market shaping tools that are only possible in the context of a pooled procurement mechanism. And most importantly, it does enhance kind of the resilience of the supply chain, because you have a broader supply base. You can utilize a broader supply base. So there is undeniable benefits to procurement. I will be also giving a word of caution, of course, and I think CAREC countries realize it. It's not a panacea, right? Pooled procurement is not a panacea. There's other factors like broader, geopolitical developments, broader market shortcomings, a general scarcity in health financing and other issues that affect access, right? And it's also not only about let's pool demand and let's buy together. There are other critical elements, regulatory alignment as one of them, sustainable financing mechanism, another one. And we've been, as ADB, through our TA, supporting also those adjacent areas. And actually, Valeria has been leading on the regulatory harmonization side in that initiative as well. I'll just echo what I think Christopher Lim said from PAHO. I think most importantly, it's not a technical exercise. It does require political will, it does require political commitment. And we've seen a number of instances where without this solidarity among countries, some of these initiatives were very short-lived, and others never get off the ground. Big announcements in the beginning, but in the end, they never actually got off the ground. So it is a difficult task. I think CAREC provides a platform that makes us cautiously optimistic that through that, we can build on this existing long-standing partnership to actually align both a technical and political kind of framework that will allow us to support countries to use pooled procurement as a truly transformative tool in that region, right? For immediate access issues, but also for the longer-term health security in the region. And so, yeah, there is, and hopefully this might also be a pathfinder for other, like for example in the Greater Mekong sub-region, where we also have a regional cooperation platform that could also benefit from learnings from CAREC. So I'll just say in closing that there is no kind of standard solution to this, right? There's a lot of examples out there. interesting examples that we can learn from. None of them is just a boilerplate template that we could just apply to CAREC. And so I just want to make a shout out to Advance, as you know, these are the types of networks that are needed exactly for those countries who are exploring new novel opportunities in procurement to exchange, right? To tap into a wide range of stakeholders as they think through how could this be done in my particular region. So something we intend to achieve with Advance as well.
Thank you, Philip.
Thank you.
So I just want to thank all the panelists. I think, you know, it's a complex task, but it requires action on all of these fronts, right? It's got to be a comprehensive response. And that's, ADB is up for the challenge, and it is complex, and it will require collaboration and sustained resources. But we're up for that, right, Dodo? And you're going to tell us about that in your closing remarks. Thank you, everyone.
It's great to see everybody still here, right? So, no, I think we had. I think first of all, our apologies. We only got 2 hours. I was just listening. I think this needs 2 days of discussion. It's very rich, very productive. Lots of lessons, lots of potential areas of work that we could be working on. I think there'll be a number of you that will be staying on, right? Will be so when you know in the next there will be others who will be here also for till tomorrow. So let's keep on having the conversation. So I think as we finish the afternoon, the next question is what will be next, right? For ADB, I think the first is that a very obvious answer. We will soon have an advanced portal because a lot of this information I think should be available to everyone, whether we talk about harmonization efforts that are being done by the different NRAs, or even work that's being done by, it's only now that I realized there are 4 NRA networks, right? But then I was more aware of what ASEAN was doing, but I don't know what's been happening with ASEAN. So a lot of this information are actually there. So we in ADB, we could, how do we call that, consolidate all of this. And we're quite good in maintaining, well, we claim we're quite good in maintaining IT platforms. So we'll make sure that this will soon come out, that we'll have this platform to be available to everyone. And so it will be much more easier to be. I think we'll continue to convene everyone, both the NRAs, the manufacturers, the consulting firms, the experts who are here. You know, Valerio, actually I saw him this morning, forgot who he was, you know, because it was like 12 years ago when we were talking about malaria and all that. But in a sense, I think that should not happen again. You know, I think we should all show our faces to be, because I think this interaction is very critical for us to move forward, because we're all like-minded individuals here. And we're all kindred spirits here. We in ADB are listening to the points that you've raised. That's why we want to hear more, because we want to see how we could also mobilize the resources of ADB. As also you recognize, having a bank in this story, in this discussion is something new. Frankly, as I think I was talking with Philip, I was thinking, you know, maybe, you know, this pooled procurement with the ability of ADB to support countries build up their manufacturing capacity is a nice virtuous cycle, right? So maybe pooled procurement has not happened in Asia because you talk pooled, but you're talking about buying from everyone. But if you combine it with building regional manufacturing capacity, and then you have pooled procurement, then you sort of create another virtuous cycle of money moving from one part to the other. Of course, on the assumption that WHO will make sure that the manufacturers are of good capacity. And since we consider ourselves to be the favorite MDB of WHO right now, yeah, so I think we are, I'm saying that. So I think there's really lots of things that we can do. So I think the way we have named this, we call this Advance, because we're forward-looking, right? We want to make sure that this Advance, I think, you know, as what everybody has been saying, what Jay is saying, we could not allow discussions whether single dose, multiple dose, or NRA struggling whether they would recognize a particular vaccines or not, or diagnostics being, how do we, the Global Fund is. I always love to say, there's a lot of pilot presentations. We in ADB, we always get that, people presenting to us pilot diagnostics and all that. I always wondered, why isn't it already rolled out? Why isn't it already out, right? So we look forward to a world where all of this would be, how do we call it, timely, rapidly be made available to everybody, because at the end of the day, our ADB, we have a nice vision statement. We envision an Asia that is resilient, inclusive, sustainable. This is probably gonna surprise you, prosperous. Asia and the Pacific. So we started as a bank that wanted an Asia free of poverty. Now we're forward-looking. We want Asia, we believe in an Asia that's going to be inclusive, resilient, prosperous. And I think with advance, we could all achieve that. So thanks a lot, and have a nice afternoon. So enjoy great Korean barbecue for those who are not vegetarian. For those who are, well, I think good luck. This is a country that has good meat, so yeah, enjoy the day and the dinner. Sorry, can we ask